Hello guys, good evening if you are in USA, and good morning to all our followers and attendees in Philippines. It's me, Dr. Jenny Yusuf, physical therapist and Doctor of Physical Therapy, creator and founder of Balance and Fall Support Group in Aging Adults. I'm also the president of Fusion PT and Wellness and also the current vice chair of Global Health in Aging Adults. It is an special interest group in the Academy of Physical Therapy Association. So whoever doesn't know me yet, I'm a doctor of physical therapist. I graduated in Philippines as a Bachelor of Science PT and graduated here in University of Montana. I'm also board certified specialist in geriatrics and a certified exercise expert in aging adults. So I am your host tonight. And today in Philippines, thank you so much for joining. This is our first year for the Innovator Summit 2023. So for the Innovator Summit, we will going to highlight different technology, apps, any innovations that may be helpful for rehabilitation. And for this year, we will going to highlight things that will help in falls prevention, robotics, or that will affect and the technology that might be helpful in your outpatient, stroke, and neuro, and also pain management. All right. So we will be opening now, and to discuss, we are welcoming everybody. So in the chat room, just put where you are from. That way we can connect with you, okay? So this is day one for the Innovator Summit. So welcome everybody. And these will be our speakers for tonight. It's around 5:30 here in US. I'm Eastern time, and welcome and thank you so much for joining. I know it's morning there in Philippines and wherever you are. We are all over. We even have from different places. We even have from London. So here, our opening remarks will be from the Future Foundation Global President, Dr. Eleazar Tayag, and we will be followed by Hello Note with Noman Said, and Neuro Rehab VR with Drew Stover, and Bill Hall from Web FCE, and Vestibular Training from Sheila Tellen. It will be closed by our friends and colleagues from Newgate. All right. So let's welcome Dr. Eleazar Tayag. He's a physical therapist and doctor of physical therapist. He's a board certified clinical specialist in geriatrics and orthopedic physical therapy. He has also specialized in Oasis. It is in home health that is being used, and also advanced competency in home health and home modifications. He is currently serving as an administrator, co-owner of Imperial Home Health, and Imperial Home Health is also one of our sponsor in the recent geriatric rehab summit. So thank you so much, Dr. Ellie. And he is the vice president for clinical operations and co-owner of Caring Shield Hospice Care, and the founder and CEO of Optimum Care Provider in California. Now, he is the president of the Future Foundation Global. It is a nonprofit advocacy organization for global Filipino physical therapists. And this event will be helpful. It is like fundraising. So we will get to know what is Future Foundation, all right? So here we have the mission and vision, and Dr. Ellie will tell us more about it. So the Future Foundation is a nonprofit organization, and we will learn more about the different projects. So we would like to give the floor to Dr. Ellie, and thank you so much for joining us today, okay? All right, Dr. Ellie is being right now. Welcome, Dr. Ellie.
Hello. Hello. Good afternoon. This is Dr. Tayag. I am the current president of Future Foundation Global. Thank you very much, Dr. Jenny. So pretty much, I would like to welcome everyone. Good afternoon, US. So those ones in the Philippines, a very good early morning. Actually, it's like close to 6 o'clock in the morning, right? So thank you very much for attending. I'm sure we have attendees all over the globe as well. So thank you, Dr. Jenny, for organizing another very successful event after that annual geriatric summit that we did a few months ago in July, if I'm not mistaken. I was also one of the speakers. I pretty much discuss about Medicare home health. But today, I'm here for a different reason. We didn't have enough opportunity to actually introduce our nonprofit organization last time. So this time, I'll be opening the Innovator Summit by introducing to you Future Foundation Global. So let me share my screen. So our foundation is called Future Foundation Global. It is a registered 501c3 nonprofit organization in the state of Nevada. When you say it's a registered 501c3, it means that any donation to the organization will be tax deductible by the IRS. So our history, it was founded in 2016 as Future Foundation by Drs. Consi Aguila and Dr. Ben Aguila, and started as the official alumni organization of Far Eastern University, which is a university based in Manila, Philippines. This is where Dr. Jenny actually graduated from for her physical therapy degree. So in 2021, it expanded to actually from being an alumni organization of FEU to accepting non-FEU alumni as member of the board of trustees. And I was the first non-FEU alumnus to be part of the board of trustees. In 2022, Future Foundation was sunsetted, and in 2023, it gave birth to Future Foundation Global. So Future Foundation Global, like what I said, is an IRS recognized 501c3 nonprofit organization registered in the state of Nevada. So Future Foundation stands as a beacon for Filipino physical therapists dedicated to empowering their pursuit for excellence and professional growth. Our vision is a world in which Filipino physical therapists will become esteemed leaders and pivotal contributors in the global rehabilitation community. So through the unwavering support and resources that were contributed by many people and organizations, Future Foundation is shaping an environment where Filipino physical therapists all over the globe can achieve their full potential. So what are the core programs of Future Foundation Global? The first one, scholarships. Second, skill sharing. Third is charity. Fourth is community. I'm going to share to you our different projects all over the years. For scholarships, we have the Ad Astra Scholarship, which is the only scholarship grant benefiting Filipino physical therapists that offers opportunity to obtain tuition assistance for transitional doctorate in physical therapy, this is in partnership with the University of Montana. And we also do mini grants like what we do with annual geriatric summit, like Dr. Jenny, where we provide free grants to multiple physical therapists all over the world so that they can see the summit for free. So these are our first two scholars of the Ad Astra Scholarship. Dr. September Bronio actually already graduated, and Maria Angela Boras, she already finished her DPT, but waiting for her graduation. So in the last 2 years, we have two scholars. We also do skill sharing. So through Future Foundation, we were able to facilitate with a partnership with University of Montana Rehab Essentials and FEU to provide Doctor of Physical Therapy program for global Filipino PTs. When I say global Filipino PTs, these are PTs that are located all over the world except the United States. So they can actually avail of their DPT program virtually or online through University of Montana. We also have done seminars and workshops like this annual Geriatric Summit or Innovator Summit. We have also conducted several seminars. Myself, I did one in June at the Lyceum Northwestern University in Dagupan City, where I graduated. And also a lot of the Board of Trustees of Future Foundation Global are very active. We have few APTA leadership scholars. We have speakers, keynote speakers, presenters in the different APTA CSM conferences and APTA state conferences. So this is a collage of some of the seminars or the events that we did conduct. We also do charity work as well. So during the pandemic, we did donate a lot of PPE, personal protective equipment, and medical supplies. We have done, sending condolences and sympathy flowers to those of our colleagues from the Philippines who passed because of COVID-19. And also we offered financial assistance for medical illness costs. We are also very active in community building. For example, Future Foundation and Inspire Swaits, which is the Indian Physical Therapy Association, we have spearheaded the APTA ALI Multicultural Catalyst Group. We do a lot of social networking in person and virtually as well. We have the Future Foundation website and community, which is very active on Facebook. And also, we do patient advocacy. For example, we started Kilos, which is a Filipino term for movement, Kilos PT, which pretty much advocates for patients and communities to move and exercise. And also, we do a lot of professional advocacy. So these are some of the pictures of this community building programs. So this is the Board of Trustees. There's like 11 trustees currently. I am the current president. Dr. Youssef is our treasurer for Future Foundation Global. We have other doctors of PT. These are all Filipino physical therapists. So I want to invite all of you to join us. And if you have any amount, even just one Starbucks coffee instead, it can make a big difference. So if you want to donate anything, $1, $2, Starbucks coffee or whatsoever, this is our PayPal QR code. So that's it for me.
All right. Thank you so much, Dr. Ellie, Dr. Tayag. And if you have any question, guys, if you have any question, just feel free to always ask us. Dr. Tayag, how can we connect with you? Any emails that you can put on the chat if they have question?
Yes. Let me see. Our email is right here. It's trustees@futurefoundationpt.org, but I'll also type it on the chat group.
Yes, thank you so much. All right, guys. So thank you for all your support. Just attending the summits, different summits already supporting us. And then we even have the Future Foundation Global Facebook page. You can share your different thoughts. And also if you have nice things to share, even that's related to physical therapy or any updates, articles, you can always feel free to share with us, okay? And if you want to know more all about us, the officers, the different board of trustees, what we do, we already have highlights here. So Dr. Tayag, thank you for all the support that you're always doing for us and also your leadership. All right. Thank
My
you.
pleasure. Thank you, Doc
All
Jen.
right. Live from California, guys. So I told you we're all over, right? So thank you, guys. So we are getting more and more, and then it's being explained already. So that is Future Foundation. And how about our next speaker? So we are going now on the event for the Innovator Summit. We talk about, when we say innovations, we always talk about the different technologies, right? What are those things? It can be artificial intelligence, robotics, or different technologies that you can wear, you can use, you can see. And how about an artificial intelligence that you can use as a physical therapist in your clinic or Med B here in America? All right. So for tonight, we have Noman Syed, and he is from Hello Note. So Noman is a healthcare transformer. As a customer solutions manager at HelloNote.com, Noman is passionate about empowering healthcare providers with innovative EMR or electronic medical record, optimizing workflows and improving patient outcomes. He's also a growth catalyst and as the growth coach and lead general specialist at TuneUp Social Media. He helped lots of businesses reach their heights and also target leads, and it improves the revenue growth. He's also digital strategist, and with over a decade of experience in e-commerce, digital marketing, and social media consultancy, he is an expert in web project management and campaign planning. So if you always see SEO, he is masters of that. So he's a sales trailblazer, and Noman's impressive track record includes high-value sales, and he has partnership with leading brands like Microsoft, Red Hat, and Salesforce. Now he will talk about Hello Note. That's amazing, Noman. And thank you so much for joining us tonight, because we would love to learn more about you and also the company. All right. Hi, welcome.
Thank you so much for such an in-depth, comprehensive introduction, Jenny. Appreciate it. And I'm looking for the learning as well. Good morning and good evening to everyone from USA and all over the world. I'm delighted to welcome everyone in today's webinar as well on a topic that's at the forefront of a modern healthcare, how AI is transforming practice management. My name is Maman, and I have the privilege of serving as the Customer Solutions Manager for Hello Note, where we are passionate about driving innovation in electronic medical record systems. As you all know, the world of healthcare is rapidly evolving, and embracing new technologies has become an imperative. AI, artificial intelligence, is not just a buzzword now. It's a game changer. Today we will embark on a journey to explore how AI is revolutionizing the way we manage practices, deliver patient care, and optimize operational efficiency as well. Throughout this presentation, I'm going to uncover some tangible ways in which AI is reshaping the landscape of healthcare practice management, from automating administrative tasks to enhancing patient engagement, care, and delivery. And last but not the least, as we move forward, basically, I want to let you guys know that as we dive into the fascinating world of AI-driven management, we will explore some real-world examples, which in case would be Hello Note. And the second thing is that, if anyone has any request for a question or answers looking for that, they can actually drop an email with it, or they can also chat on drop a question on the chat as well with your email ID. And at the end of the presentation, you will also get to see my email, our email ID as well as our contact number to reach out to us. So let me share my screen with you and let us begin. Give me 1 second. Sorry for the delay. Okay. I will have to stop sharing for 1 second, Dr. Jen. Is that okay?
What's that?
Yeah, I will have to stop for 1 second because there's some
Okay.
glitch.
Okay. Yeah, you
Get
can
back
do.
in a minute.
Yeah, you can screen share again later. It's nice with PowerPoint.
Okay. Hope everyone can hear me. So let's begin. Sorry about the delay. How are
We
we?
cannot see your PowerPoint, Numan.
We cannot.
No, it's only a piece of white. It's only black and then white. Yeah, this one we can see.
Okay, you can see this one?
Yes, and then you can just make it like a PowerPoint presentation or
Yeah, it was because actually
or
the
just make it
annotate.
big. That's okay. Here, you can put it here.
Yeah, that's better. 1 second. Is that okay now?
Yeah. So it's not really on the PowerPoint slide, but we can
There's
see
some,
it. We
yeah,
can
it's
see it
some
now.
kind of error taking place. Anyways,
Mhm.
let me begin with that. Okay. So how are we using AI in medicine already? We are using AI for medical imaging analysis. AI is used to analyze medical images such as X-rays to pinpoint the exact treatment a patient might need. Electronic health record analysis. AI can also be used to analyze EHR data to identify patterns and trends that can inform clinical decisions making and improve patient outcomes. Medical diagnosis and decision support. AI is being used to help diagnose disease and provide decision support to therapists and clinicians by analyzing data and medical diagnostic information as well. Moving forward, documentation. Why documentation is important? Uh, uh, because with AI, we have been creating templates. AI can identify patterns in data that can be used to develop documentation templates. For example, by analyzing therapy notes or medical images and other patient data, machine learning algorithms can identify common data elements such as demographics, systems, diagnoses, and treatments, and suggest appropriate templates for documenting patient care as well. Moving forward, we have concise writing as well. Good grammar is important for billing. Insurances can choose to deny a claim for many reasons. One of those reasons is if the goals aren't properly filled. There are no good goals, then there are no good uses for therapy as well. And the AI can help therapists catch any errors in their writing. Besides errors, AI can also help assess the quality of the writing as well. And emphasizing info is another important aspect. NLP can help emphasize medical diagnosis in medical documentation by analyzing the language used in therapy notes and reports to identify key diagnostic phrases and terms. NLP algorithms can then use this information to highlight and categorize the diagnosis as well, making it easier for therapists to identify and understand the patient's medical condition. Coming to how does AI help you get patients? So here's a checklist for that, which includes patients acquisitions, chatbots, predictive analysis, intelligent scheduling, patient engagement. Let's dig a bit deeper into it as well. And as we move forward, we have chatbots in HelloNote 2.0 as well. So how that works is like if you're a practitioner using chatbot HelloNote, all you need to do is basically go on the help button and you will be able to communicate with the chatbot, and they will be able to help you out with all your queries and concerns at the same time. And at some point of time when AI gets into force, they will also be predicting what kind of information or source you are looking at. The other aspect of predict AI would be predictive analysis and intelligent scheduling as well. In predictive analysis, AI can use predictive analytics to analyze data on past cancellations and no-show rates. Intelligent scheduling can be done as well. AI can optimize your appointment scheduling by analyzing patient data, provider availability, and resource allocations to suggest the best appointment time and reduce wait times as well. Patient engagement, AI-powered chatbots and virtual assistants can help to engage patients with answer appointment questions, reducing the burden on staff to reduce the routine inquiries as well. Moving forward, we come to how does AI help the billing process? When it comes to billing, we do talk about claims management, denials, revenue cycle analysis, and predictive analysis as well. So in this part, what happens is claims and denial management, AI-powered claims management tools can automate the claims submission process by verifying patients' eligibility, checking for coding errors, or identifying potential billing issues. They can reduce the likelihood of claims as well. The other option is the denial management. AI can analyze data from previous claims to identify patterns and trends, and that may lead to claim denials and generate targeted interventions as well. As we move forward, we have a predictive, as we move forward, we come to billing in AI. Hello Note. As you are all aware that at this moment in time, there are over 70,000 billable codes in the healthcare industry. And that is a true nightmare for medical coders who spend the days matching medical visits with the corresponding code. And we all know, and we have honestly gone through this quagmire as well. With Hello Note AI-enabled billing, we have sent practitioners to a self-driven mode, just like a Telsa, but you are safer there. So again, Hello Note AI-empowered billing solution offers helps in automation, the coding process to provide a scalable solution that reduces the reliance on the presence of proficient billing expert as well, enhancing your cash flow through timely issuance of precise patient, also precise patient statements, and decreasing the conventional working hours of administrative personnel, thereby enhancing their performance in their domains. And I know some of you might be thinking, he's going after a job or something, but no, you can be put into a good cause somewhere else as well. So, and apart from that, AI helps in performing audits, in real time, connecting to also unstructured data. There is a lot of unstructured data out there that can be put into a useful use, and extracting those data through AI when needed is a whole lot more scenarios. So this is how billing is helping with Hello Note as well. So in conclusion, I would like to say that, moving on to the end of our slides, I would want to express my gratitude for everyone's participation in today's webinar, and your engagement and interest in our topic, as well as the Hello Note EMR system, are truly appreciated. So should you have any questions or require further clarification or seek additional information related to today's discussion at our Hello Note EMR system, please do not hesitate to reach out to me. We are here to assist you in any way we can, and you can contact us at hello@hellonote.com or call us at 212-457-1037, as you can see it on your screen as well. Thank you once again for joining us today, and hope to have a very forwarding and assisting, rewarding journey in the future as well. Thank you and have a great day.
Thank you, Noman. If you can put your contacts, the one that is in the last part, the Hello Note, the number on the chat, that way they can save it, and also the email whom they will going to contact. That way, if you have any questions, guys, so one of the team or Hello Note or even Noman himself will be the one answering. So Hello Note is founded by Steve Gluck. He's an occupational therapist, so he's a physical therapist like us. So he's having difficulty. He knows the challenges of being a therapist in documentation. So he thinks about these solutions as well. So if you have a Med B or in outpatient setting, things that you are building a small business that is clinic, so connect with them if this will fit for you. All right. Thank you so much, Noman. Thank you so much, guys.
You.
Yeah. Noman, just send it to all because it says straight to me. Yes. The Hello Note and then or the numbers there. All right. Thank you. That's really informative. At least that's artificial intelligence, right? So more and more things we're learning about that. All right. So that's first speaker. And that's Noman. So here, our next speaker will be, let's get to know more about virtual reality. How about virtual reality? Oh, wow. So we have Neuro Rehab VR. We have Vina Somaredi as the founder, and then they are one of the speakers of the Geriatric Rehab Summit at one point. We even have Chris also for the neuro rehab VR, and then they explain more about virtual reality. For tonight, we have Drew Stover. He is also a neuro clinical specialist and neuro rehabilitation specialist. Through his work within the neuro rehab space, he has developed a passion for helping others and become dedicated to optimizing physical well-being and pushing the boundaries of potential. His mission is to assist clinicians with more efficient and engaging ways to treat patients in civility and in military with the use of virtual reality. He is a neurological rehab specialist and has 2 years of clinical experience working with individuals affected by SCI and TBI and stroke. So really neurological. So that's really amazing. Thank you so much for joining us, Drew. So we give the floor to you. All right. Nice background.
Awesome. Yeah, thank you. Thank you for having us. We appreciate the opportunity to share some knowledge with you guys and kind of what we going on our side of things.
Of course.
Perfect. So I'll go ahead and share my screen. Perfect. All right, we seeing that okay?
Yes. Thank you.
Awesome.
Yes.
Of course. Yeah, so we'll go ahead and jump in it too. So we are neuro rehab VR. Essentially, what we are trying to do is combine virtual reality with all forms of rehabilitation, neuro forms, non-neuro forms, anywhere from neuro to musculoskeletal, kind of anything you can imagine, honestly, is what we're trying to do and pivot off of kind of to have virtual reality assist with traditional types of therapy. And then here in this presentation, we're going to show you specifically how it can be used with an aging population for kind of a prehab based and then also a rehab based, and the different functionalities we have within that for therapists that are looking to either consume VR or don't have a lot of knowledge about VR and what it could actually do for their clinics. So I'm happy to share that today. And then we are going to get moving forward here. Awesome. So she kind of went over my bio, touched on it really well. So I'll kind of start this off with VR terminology first of all. So these first couple minutes, I'll kind of give you a brief overlay of the different types of VR, then what we are and specifically what our device can do. So for those that aren't familiar, there are a couple different types of virtual realities out there. So this is augmented reality. So essentially this is when you're having the environment interact on your phone, when you're seeing the real world through that, as everybody remembers the famous Pokemon Go, as you can interact with them on that virtual screen while still seeing the real world around you. So that's the first type of it. The second type is virtual reality. So we have fully immersive and non-immersive. Non-immersive are those games and applications like the Wii Sports, where you are playing it in real life and interacting with the virtual world. So they were using the controllers to interact with TV, but they were not fully submersed, so they could still see their surroundings while playing that game. Same thing with driving simulators, how you have external steering wheels, and you can also see that screen, and that's how you're playing. Fully immersive, which is what Neuro Rehab VR is when you're completely absorbed in an environment. You cannot see any outside factors. You're completely absorbed in the environment and interacting with the environment. So you're playing the applications in the game when your bodily motions are interacting with it. You can see it. You can look around all 360 and you will see everything that is within that environment. With our device specifically, we have it's called a play boundary. So for whatever reason, if you were to step outside of that play boundary, it's called like a safety net. We have a camera that would open up on the outside, so you would actually be able to see the real world, but only in terms for safety. So as long as we're in that play area, which clinicians can set, you'll be fully absorbed in that and then be able to interact and do our forms of therapy. And then this is extended reality. So when you are physically moving things in the real world environment, but through the glasses. So as you can see down below and what Meta has recently come out with, where you're actually moving things, it looks like you're moving them in real life, but really you're just interacting through the goggles and allowing the environment to still be seen and you interact with that real environment. So the first thing we'll kind of get into as we kind of get into this therapy portion of it is the efficacy of rehabilitation, specifically for VR. So the research can support the neuroplasticity properties that has been held through VR over 3 decades of research and the evolution of that. And once again, I have a study dropped right below that. All of our references will be kind of at the bottom at the end of this. I'll flash those so you guys can look at those for a little bit if you need to relate back to those. But this is just an example of what we kind of try to teach and practice with our VR and how we relay it to our facilities that we're in. Is the neuroplasticity principles for motor learning. We go over 6 specifics of them, but this is just 11 principles that have shown to been effective. And then here is what we specifically have identified within VR that we try to make sure we implement. So that's task specific, variable practice, increased difficulty, knowledge of results, so you get explicit feedback, knowledge of performance, implicit feedback, and then also promote use of the affected limb. So all of these I will kind of touch base on, especially the knowledge of performance results and affected limb and increasing difficulty. That's how we can modify it to what our clients are and make it super adjustable depending on their ability levels. So here's an example of kind of what motor-based rehab that's supported by literature through VR that we've seen kind of across the scape, and then also what our applications are tailored towards. So as you can see, gait training, balance, both extremity functions, trunk control, cervical range of motion, acute and chronic pain, motor coordination, and then anything that's orthopedics. So we have some stuff that's tailored specifically to musculoskeletal injuries or whatever in that realm. Is what this is kind of based off of. And this is based off of a variety of injuries, diseases that we've all developed this in-house clinically, specifically for the use of these types of rehabs. And then here is neuro-based rehab supported by the literature. So this is what we can also, through our applications, the use of VR, assist treatment in alongside traditional therapy. So stroke, Parkinson's, the list goes on, memory disorders, even autism spectrum disorders. We have environment therapy to where we can actually place them in an environment like a shopping center or a cafeteria where they can work through directions, reading, following steps. And then all the way down the line, even as far as speech. So the shopping center one, we can have them reading the items on the list. So we have word versions and picture versions, and then we can hide the shopping list. So it can get really intricate outside of just playing games within VR. We really try to think of it as therapy, not actually just playing games in there, because we have actual modalities and difficulty ranges we can actually change specific to patients. And then so here's just a couple snippets of the research that we have pulled down towards the end of this presentation. And we try to tailor it to exactly what's going on in the aging population, what we see a lot of. So that's a lot of stroke. We have multiple sclerosis, gait within Parkinson's disease. So tailored to kind of the aging population and things that we see in our clinics kind of on a day-to-day, year-to-year basis and how that actually changes. And then so now we'll kind of get into the chunk of what we actually have. So here we have prehab and rehab, usages of VR in aging populations to prevent and rehabilitate injuries. So here's an actual example of our before we get into that, here's an example of how we can assist the aging population. So the goal of this is to show you how we can help improve balance, reduce fall risk, and increase longevity through the play of VR that's actually very correlatable to your traditional PT. And so here's an example. This is kind of getting into what our device specifically is for. So on the left, we have our application Leg Day, which is mainly focused for lower extremity tracking. We have a data portal within every application you play. So all your movements get tracked into that data portal, and all the stats that we keep track of in each specific game kind of varies, but they all get pulled into that data portal that clinicians can see in real time. Just so for example, we have Leg Day. It's an adaptive range of motion. We can do it seated or standing. But within this, it's not in the game. They're actually just kicking a soccer ball at targets, but it actually does get a little bit more intricate than that. So we have motor coordination because they need to either kick the ball on the inside, the outside, depending on what target they're specifically aiming at. And then if they're standing, we can work on ankle stability. If they displace from their midline at all, they're getting off that midline. So balance becomes into play. And then out of all of our applications, there's a vestibular demand because the vision aspect of it is kind of pulled away because you're now in a new environment. So you're heavily relying on that vestibular system for balance. And that's what we've kind of trained that a great ordeal throughout all of our applications. And then also trunk stability. So if it's a spinal cord injury or, someone with a back injury in general, and struggles having feet getting lifted off the ground, this has been a great way to kind of introduce that. On the right, we have Loco Sprint. So Loco Sprint, what that is, it's a gait training exercise. We can do that seated or standing, ambulation, pre-gait training, arm swing phase. So a bunch of different things we can kind of work on here. Coins collected, distance traveled, and speed traveled is all taken into that data portal. And then so for those with cardiovascular issues, lung breathing issues, or even anywhere down to musculoskeletal injury, this is an example of kind of a basic gait training exercise. And then it is gamified environment. So the research is what supports that gamified environment. You can't see any limbs in this one. It's strictly just based off of movement. We try to get the max movement as possible by taking out all the hindrances people might have in like the visual world. If they have an affected side, if they're not moving as fast, and they can see that, that's the research kind of behind the actual gamification environment. And then within this, we can do ground force impact progression. So if someone recently had knee replacement, hip replacement, ankle surgery, kind of anywhere along that aspect of it, this is a great one to do that because it's gamified. And then we can also just reintroduce that if they're doing high knees marching or even just seated ambulation, tapping their feet we've kind of seen very good results coming from those specifically. Moving on to the functional range of motion aspect of it. So on the left here, we have one of our more staple games. It's called retail therapy. So within this is that shopping center mechanism. I know these images are probably a little bit blurry over Zoom and because it's a GIF, so we have it on a kind of continuous loop. But they are super clear in when you have the goggles on, everything is super clear. We have a high frame rate. So everything looks super nice. But essentially in the shopping center one, they're reaching. We have the cognitive memory list, so we can hide the shopping list. We can take it away. It says what the items are, or we have the pictures on there. So it's great for OT, PT, and speech. So from a PT standpoint, working on different ranges of motion, seeing what items we can reach on shelves, what items we can't. From an OT standpoint, we can see if it's safe if they're in a wheelchair or if they're standing. We can actually have them practicing shopping in a grocery center until they're safe to do it on their own. And then we can also see where they need improvement, whether it's how far they get off their midline, if they begin to fall over, items they can't reach. Kind of a bunch of different things go incorporated into that one, as well as mirror therapy. So within this application as well, we have mirror therapy where if someone has an affected side, like say stroke, we can actually mirror their non-affected side. So in the actual environment, they're picking up items with that affected side. And then able to get the gratification of seeing it picking up. And then we hope for some neuroplasticity principles to kick in as well, because they are continuously trying to reach with that affected side. And then in the environment, they actually do pick it up. And we've had a lot of great feedback from people that do use this and the OTs that really want to work on that affected side range of motion. And then on the right, we have a range of motion application that's specific to that. This measures to within 1 degree of accuracy. So within those controllers that we have in those hands, it's based off of that. So it actually will give you arrows too, telling the patient where to look or where to reach. And then you on the tablet can see in real time what they're doing and help them out doing that. As they're doing these movements, they can see in real time the degree they were just at in the previous rep. And then we usually will coach them through it, say, hey, you were just at 60 degrees, arm flexion. Let's try to beat that. Let's try to get to 62, 65. And we can all continuously see that they get pulled in the data portal. To actually see from a progression standpoint how well our clients are doing, if they're improving, if they're not improving, and if so, what areas can we help be better, or what areas are we doing good in. And then that's also for cervical range of motion in too. So we have six kind of motions within that cervically as well. So that's been huge. As far as TBIs would go, cervical injuries, spinal cord injuries, we can see from a day-to-day basis almost what our ranges of motions are looking like, all pulled into that data portal. And then here's a mental health and wellness aspect that we have to it. So within this one, we've seen decreases in blood pressure either before or after training sessions. And that's been really big because typically when we do that, our patients are more receptive to therapies. We have to take less breaks as they do that because we can kind of calm down. We can calm down that systems that will kind of allow them to kind of do more therapy, if that makes sense, because we have them in a more calming state before. And then after, we can bring down that blood pressure if things kind of got aggravated, got a little bit too aggressive. We've used that in the past. And then also for pain distraction, if you want to work on soft tissue injuries where there's like where there's pain, they're in difficult positions. We've used this, the one you see on the left where they're on the beach. There's guided meditation, guided breathing. So it's telling them how to breathe, as well as box breathing. So a bunch of different breathing techniques as well. If you do have any type of, populations that need assistance with their breathing, if they have lung transplants or anything very similar to that. And it's full 360 that you're absorbed in, so you could look around any angle you would like. And on the right, we have our rhythmic auditory stimulation application called rhythm therapy. So within this, with populations, we've seen that the music that's added into this one, because there's spatial audio, along with the motor coordination sequencing of the upper extremities, hitting the notes at the same time the song is playing in sequence, has been very beneficial to the range of motion. And then also we've used it for standing tolerance as well. So those with lower extremity injuries or want to work on balance, as you can see, he's kind of swaying side from side. We'll get off that midline from time to time. And then he's also working on upper extremity movements from a PT standpoint, if there is anything specific you want to work on. And then also you can do this seated as well for trunk control. And this is a good one to have integrated into that VR for people who want to get used to playing it, want to get used to being absorbed in an environment, or it's great for other populations who even like music, who it was specifically intended for previously. And then here, this is the last one we have here. This is our reaction time and motor coordination. So within this one, aging populations, we like to use this as well, because on the right, he is going kind of high speed there, but we can modify it. So within all of our applications, as you can see on the left on that tablet, we have a sliding scale on all of our applications to where we can make difficulties of the games faster, slower, more difficult, or easier. So on the left there, he's playing foul play, where essentially there's a cannonball being dodged at you. You have to displace either laterally, or you can do sit to stands as he's doing to dodge that ball successfully. And then so from a modifiable standpoint, we can have motion amplification that we can increase. So whatever he does in real life is actually amplified in the environment in the game, so he can successfully dodge those balls. So if someone has a smaller range of motion, can't laterally displace as far, we can increase that motion amplification to where in the game they actually can displace that far. And that's where we've seen improvements of overall range of motion, is because they're continuously working in that specific area. And then we can bring down that amplification to where they actually do have to displace a little bit further in real life setting. And we've seen great improvements that way. We can increase and decrease the ball speed. Same thing with that baseball game you see. We can make it super customizable depending on what your client is specifically looking for. So if they want to work on their hand-eye coordination, we can make it faster, slower. We can have all of the pitching machines firing, so they have to visually scan and kind of work on their visual acuity, where those balls are coming from, visually scan from left to right, each pitching machine as they're getting thrown. And then also we can customize where those balls are coming at. So as you can see, there's a green grid line. We can customize to what area those balls are going to come in, so you can work on specific points with those clients. So for example, in the aging population, getting up and down is a big one. So we can actually have the lower box field and the upper box field, it's nothing in the middle. So the balls will only come at their feet or at kind of over their head. So they have to continuously work to reach by their feet, back up over their head, to their feet, back up over their head. And then once again, all this gets tracked in that data portal. So balls caught successfully can all get tracked in there. So over time, we want to see them get better and better at this. And it can even get customizable to the point to where we can make the ball bigger, medium, smaller. We can adjust the distances of those pitching machines. So if someone needs a larger reaction time, we can actually scoot them back. We can increase, decrease the ball speed. So we can make it pretty customizable depending on what your clients are needing and how kind of, I guess, fun you want it to make it, depending on you knowing your client. But it might just look like he's catching baseballs from standpoint, but from an actual clinical standpoint, that's what we can actually do to change those movements and how we want to make our patients better. And then within that, there's also total body vestibular demand. So this one is great for balance, because you're going to be doing a lot of motion throughout this. As you can see, he's almost going into triple extension at some points, crouching all the way down to the floor. Awesome. And then here is an example of our driving simulator. So this is an image of it. We do have a full simulator, so it's full 360. You can look around, the rear view mirrors and everything work. We just have a screenshot here. So essentially you'll speed up to 60 miles an hour, and this is for braking distance specifically. So this has been great for aging populations as well, because we can change the time of day it is. So we can have it be nighttime, we can have it be a full moon, we can have it be morning when the sun is rising, or we can have it be almost pitch black dark. to where there's a leading car with the brake lights. Once those brake lights come on, with our hand controllers is what you accelerate and brake with. So no foot pedals or anything like that yet, just the controllers. And you can adjust the braking distance time, so you can make sure you can have it to where they need to brake within 2 seconds, 3 seconds, 5 seconds, 10 seconds, depending on what your client needs and what they want to work on specifically. So this is linear, strictly for braking distance. But then we also have another mode that's called animal crossing. So there'll be animals, there's deer lined up on the side of the road, and some will cross, some won't cross, and then some will cross and stop in the middle of the road. The ones that stop in the middle of the road, or the ones that cross, what we want to slow down for and stop in time. We've used this for environment exposure in the past. If someone's been in a car crash, maybe has a little bit of PTSD from it being behind the wheel, if it was severe enough, this has been a great one for that, for using that. And then if they do hit the car or they do hit the animal, if they brake unsuccessfully, nothing vulgar happens. They simply just continue to push it down the road. And the car is fully intact. The animal is fully intact. So nothing vulgar happens. It just tells you the brake was unsuccessful. And then here's an example of how we use our applications to tailor to specific clients. So if you wanted to use walking speed, for example, improving the 6 vital sign, key predictor of life expectancy, and overall maybe even musculoskeletal injuries, this is an example. This is a great one for that. We can use it for cardiovascular training, whatever you guys see fit for your potential client. And that's the great thing about it being so customizable. So that application where we were just walking in place, loco sprint, we can have that on anything that's also a reciprocal motion. So new step, recumbent bike, SCI fit, treadmill with a harness, anything that's reciprocal, or even just simple as marching or swinging your arms in place. We can set the time that they're going to go for. We can set the time of rest that they need, give them specific instruction. And then after you set that time in the game, you can see them in real life on that tablet, how they're walking, how fast they're walking, how many coins they're at, and how they're doing. And you can still coach them through it. And then we just do dosages the same exact way you would do, your standard therapy dosages. So sets and reps, that's just an example of what you see here, 3 times for 2 minutes, 60 seconds rest. And then it is simulated. So however you see fit for that. And then you'll go based off of distance as well, if you don't want to do time. So you can go until they reach a certain distance as well. And then you could put them in the next gait training application, which is Explore. You guys didn't get to see that one, but that's another application that we have. So same thing, sets and reps for that one. And it also is correlated because it's a gait training exercise. And then here, we see an example of that foul play application, which we have, and there's the cannonball. That is exactly what it looks like. It's a lot higher definition than that GIF was. So this is essentially what it looks like. We have to dodge that ball, as you can see in the picture. He's going laterally, spreading his feet out, stepping sideways, or even doing a sit to stand with those arm assisted tricep dips, standing up motion. So we can do it in several different ways, but it just depends client what we want to help them with. So foul play, same thing, go with the dosage. We did 3 sets, 15 or 12, 15, and 20 reps. And that's the good thing about virtual reality, is it's super repeatable and super fast to be repeatable. And then we have the ball speed there. And that can also change. So the ball speed was 1. We could change it to 3 the next time, and then 5 the next time. So we can just base it off of the increments that you specifically would like. And this has also helped people improve for that CDC chair test and risk prediction, because it's a very continual pattern that you can do almost every session if you wanted to. And you can do it for a continuous amount of sets that they feel comfortable with and that you as the therapist would like to complete with them. Awesome. And then here, so last one we have here is our balance training. So as you can see, we can incorporate traditional therapy settings into virtual reality. So as you can see, he has that blue pad to make the feet uneven as an uneven ground surface as he's shopping in that retail center. So that's just one specific thing that we can add into that to encourage that total body vestibular demand on top of an uneven surface as they're shopping, reaching over their shoulder, reaching down below towards their ankles, reading a shopping list, visually scanning. So it's a lot of things going on, as well as our spatial audio. So we use this as environment exposure too for either autism spectrum disorder, and a bunch of other different aspects to it. There's actual people talking in the background. You can hear the music playing in the grocery store, the beeping of the scanners. So there's other stimulus other than just playing the VR and shopping. You do get that full haptic feedback through the controllers as well in a lot of our applications. This is one example. And then we have button mode and hover mode. So if you have it on hover mode, they have to reach over an item and hover over it for 3 seconds. Laterally displacing them a little bit more, throwing them off their midline, having to hold it there, then bringing it back and putting them into their cars. So it's very lifelike. We try to make it very realistic. And then as therapists, you can customize it to what you want your client to specifically do. And then here's an example of a case study that we personally did with our device as it was being developed. 70-year-old left side stroke in 2002. And she didn't begin therapy until June of 2018. So a large span of years went by with no therapy integration whatsoever. Primary symptoms was she needed a rolling walker for ambulation, right upper extremity, intention tremor, needed assistance with all her ADLs, and the standing balance was less than a minute. So as you can see, we did a pre-VR and post-VR integration assessment. Her standing balance went up by almost a minute. This is a 5-month integration, by the way. So 5 months, we gave her the treatment plan, the dosages, and all the applications to play. Her standing balance with her eyes closed went up by 30 seconds. Berg score jumped up by almost 15. And then she had a personal goal of hers was to unscrew 5 screws in 5 minutes on a screw board. And then she actually did achieve that goal of unscrewing those 5 screws in 5 minutes. And then we noticed a significant decrease in her intention tremor. And so this is an example of our data portal, kind of what you see from our device and how virtual reality can kind of combine therapy with also stats that can be written down and kind of exported. So this is an example. We do have revamped it a little bit. So now we have a little bit more metrics in our data portal. This is just an example of what you could see. So you see all the session dates on the left there, the time they did it for in seconds, and then also the average pickup time of each item. So over time, from a progression standpoint, this becomes valuable because we can see, okay, you shop continuously for 5 minutes, once a week. Week 1 versus week 6, that pickup time went down by almost a second or a half a second, which would be a huge improvement because one, that means they're recognizing those items sooner, they're picking them up, they're maybe even be able to reaching them faster. Same thing with that average range of motion. We've now changed that to average distance reached by each extremity. So you can actually see the average they're reaching. And then as those averages get higher, those levels get harder. We can compare that to the average pickup time. So they're going to be reaching further for items as they get better, and we can see that as well. And then that picked up items, we can actually see individually where each item was. It's like we can see, okay, you did good on the middle shelf, but the top shelf you actually did struggle with. And then as a clinician, you can take them back and work on those specific ranges of motions, and then come back and kind of test for a baseline again and see where they're at, and then also allow them to just get better at shopping in the game, and it's super repeatable. And then here's CPT codes that we commonly use within our clinics that we're in, people we have feedback with. So these are just a couple that we continuously use and continuously frequent. I'm sure a lot of PTs and OTs out there are aware of these. And then actually, recently, we just came out with the new CPT code 0770T. So this is kind of some information from the AMA, and then also from what we give out to our clinicians that do use this. So it is an add-on, and it can be used with any of the exercises you normally use in your therapy that are included with the XR therapy system. Below that, there are a couple, or there are the ones we can use in conjunction with 0770T as the add-on. And then you just simply add it to whatever code you're treating for extra reimbursement. And once again, that's right out of the AMA pamphlet that it came from. And then here is my contact, which we'll come back to in a second. And then here's a couple references just for the recording for people to take note of if they ever did want to go back and look at a couple of those. But as far as that goes, here's my contact. You guys can reach out to me. I will actually share in the chat to my demo link if you guys wanted anything further with our device. But at this point, we can hand it over to questions or anything like that necessary. That's going to be it for me.
Wow, really nice, Drew. Thank you so much. I love
Yeah,
the
thank you.
very animated videos. Yes.
Thank you.
So Chelsea, so how much does it cost? Drew.
Yeah, so cost, we have a couple different cost breakdowns, just because we go based off of usually either hospital systems or other systems. So the hospital systems price, that's going to be your inpatient, outpatient, kind of all revolved around that hospital where you're seeing a larger number of patients, is going to be 11,100, and that is on a yearly based subscription. So with that being said, some of our competitors will kind of have the device, get with you, and then it's hard to contact or go through it. So we try to think of it as a partnership with that yearly subscription. So our price is a bit cheaper. And then also within that, you'll get every update that it comes out with. If we have new hardware, we will update you automatically. We have a 5-second response time for on our tablet. We have a help tab that's ticketed. We can streamline into your device within 5 seconds or within 5 minutes, help you out what's going on. So we really do stand firmly on our help that way. So that's the cost for the bigger hospital systems. The smaller therapy clinics is going to be 5,100 for the entire year, and that's the same thing on a yearly subscription basis. So once again, you'll get the same upgrades, the same updates. We send out updates every time we have one at 6 p.m. Wherever your time zone is. So after normal clinician hours are done, so there's no complications with going on within training. And then, yeah, we have a 30-second setup time. So it's super efficient for clinicians to use. And those are the two prices that we mainly go off of. If you guys have something different in mind and we sit down and we actually talk about that, we've done that in the past. And then if there is more devices bought within your clinic or your hospital systems, we do bulk deals and break it down that way. But yeah, so I'll drop my link again if you got anyone wants to talk more about specific things like that.
Yeah, if you can write it in the chat, it's
Yeah.
exactly your email and also your phone number, like for the this here for everyone, like the
You got it.
website that they can check more info. So regarding is it in one hospital, Drew? Is it only one VR app or equipment?
Yeah, so sometimes it varies. So some people will have one, some people will have multiple. We are in
Mhm.
some hospital chains and some pediatric centers that do have multiple devices. Just because it's super lightweight and easy to go around, so it doesn't take up a lot of storage. And then those can actually move around if they have coordination to go to inpatient, outpatient, if it is the larger hospital systems coordinating it. So yeah, definitely there are a bunch of facilities and VAs that have those, especially to have multiple devices, multiple going at once. However, some do just have one because it is easy to move around and it's super small and lightweight. It's only a pound and a half, the headset, so it's super easy to move around. It is more efficient to have a couple if you are a bigger hospital chain or maybe even have a couple locations that you want to get them in. We do recommend getting them for like each of your locations just because it will bring in more clients that are specifically neuro based and aging population as well. That will be kind of a huge factor going into that because we can help treat so much. But yeah, so that it kind of just depends on what you're looking for, people's budgets, which is why we always try to work and see what the best opportunity is for everybody.
Yeah. So it's a software that they embed, and then this is the physical VR, which is the like a Oculus. Yeah, I think that's the one.
Yeah, so we in-house we create everything in-house. So all of our applications that we have are developed in-house by us from clinician feedback. So everything that was all the applications that were made, we actually were founded in a clinic by PTs and OTs. Everything was specific from patient and their feedback. So that's how everything was created and still is becoming created. We're coming out with a life simulator where people can actually cook and follow directions and make their own steak dinner, which has been huge for OTs. So like that was a suggestion we were getting from a lot of people, similar to the retail therapy shopping one. So like that's coming out very soon, as well as some other things. So that is one thing, is it's in-house based. No one else have their applications. And then those are all, on the tablet with the headset. So with purchase of that, you get all of that. There are no kind of hidden fees or anything like that. You get the tablet, all the applications, the headset, the controllers, everything in one.
And how about the hygiene? How do you handle cleaning it if I will going to share it with the next client or the next patient? Because let's say me, I am now in acute rehab. I used to be in home health. And then I would love to introduce this to my colleagues as well. So I have one patient, and then let's say the next therapist will use it. That's how it's shareable, right? Because
Yep.
so we can wipe how to clean that.
Yeah, so it's actually It's actually super easy to clean. So you use your normal purple wipes or kind of whatever sanitation you guys have in your clinics. Wipe down the outside, typically just where the like the eye surrounding is, and then the back and the controllers. And then you can get a lens wipe if you want. You can get a pack of like, I want to say it's like 300 on Amazon for a couple bucks. But outside of that, you could use whatever you want on the device. You don't need to buy anything separate. We just recommend the lens wipes for that lens because it could leave street marks and possibly erode over time. But
Oh,
outside of that, really nothing extra. It's super easy to clean, and like I mentioned, it's only a pound and a half, so you can easily pass it around.
thank you. So Richmond said, love the application of VR to functional exercise, innovative and fun. Yeah, I really like our OTs are doing that grocery shopping. So they really put it in the whole gym, and we have a big gym. So that's really good. Good. So let me see if there is one question here. Thank you so much, guys. From Melanie, do you have program suggestion for a specific diagnosis, like someone in the case study, like the one with stroke?
Yeah, so we definitely have our program suggestions. So if people were to usually to consume our device and they have questions on that, that is kind of primarily my role. So I'm the clinical expert. So if anybody has like usually when we talk to them and they say, hey, we have a larger stroke population or we have a larger Parkinson's, and we're like, how can we help? How can we use this device other than just having them play the games? So then that is my role. I will essentially take the majority population that you have and create a program for kind of everybody to one get eased into the VR so they're comfortable using it, they know how to like kind of move in the environment, the therapists are okay with it, and then as that goes on it'll be like a dosage as well. So as the weeks go on we can have progression, more applications played, different applications played, different movements throughout those applications. So yeah, if there is specific diagnosis that if you guys did decide to partner with us, and you had, even if it's just specific for one client, like, hey, we're struggling how to use therapy for this person, we really want to, yeah, we can get that to you. We have exercise plans already pre-made, ready to go, easily to be customizable. And so that is one thing with that yearly subscription, and that's why we want to make sure we have a good relationship with all of our clients. We want to be able to give them all the tools necessary to be able to treat those patients successfully and use the research behind VR, not only for patient engagement, but for the actual benefits of being in that full environment. We want to make sure everybody can kind of understand that and grasp that.
Thank you so much, Drew.
Of course.
Yes, Melanie says thank you for the answer.
And then
Yeah.
one last thing, we'll just drop in the chat. I don't see any more questions. I will actually drop, this is my meeting link. If anyone in here would like to either schedule further time to talk about our device or even just the VR scape in general, that is my personal meeting link. So we can meet and talk about that. Outside of that though, my email is on the screen as well, and I did drop that in the chat. So if anyone has any questions, feel free to reach out. We're in Neuro Rehab VR. We want to thank you guys for having us here. It means a lot doing this presentation for everybody. So yeah, if no one has any questions, thanks.
Thank you so much. Thank you so much, Drew. That's really wonderful presentation. Thanks so much, guys, all the questions. So we're going to take a break, and then we will have another speaker after our break time. Okay, so let's see if we can do, let me see. So Bill is here as well. So let me check out. See here. Thank you so much. All right. So Bill is here. So thank you. All right. Let me see if you have any questions. Hi, Bill.
Hello.
That's Bill Hall. I think Bill Hall. I think I put it. So after Bill, we'll have a
Yeah, it's a typo. HOL.
Yeah, sorry about that. So guys, thank you so much. Our next speaker will be from Web FCE. So if some of you might be familiar with FCE, Functional Capacity Evaluation, so Bill will going to discuss more about Web FCE and how it can be helpful in your clinic, or maybe to learn more about that. So I'm not using it all the time, but at least with this presentation, I'll get to know more about it. And this is like a fall risk assessment protocol. So let's see, Bill will going to discuss more and the research performed and conclusions made by the meta study that is behind the current fall risk assessment protocol that is being used by Web FCE. And he will show and review the procedures and protocols for performing the 12 evaluative components used to calculate the fall risk probability score, and also the general FRA software program. So this is a software that we can use, and this will be a great also fall prevention, evidence-based, and we will be familiarized with the interpretations, assessments, and recommendations that can be made with the implementation of the fall risk assessment software. All right, I'll give the floor to you, Bill. All right, thank you.
All right,
All right,
let's see here.
I'll make you a host so you can share.
Okay, and do we see that there?
Yes. So we're seeing the company name, your logo, things like that.
And then down below, do you see the little bar here?
Yes, yes. We
Okay,
see.
so okay. All right, so my name's Bill Hall. I'm from WebFCE. We run multiple programs, but in particular for this one with the geriatric, we're going to show you our fall risk assessment. And essentially, it was taken from a study done by Luzardi through the APTA in 2017. She looked at 2,000 studies, abstracts. They narrowed it down to 300 studies. And from there, they took out different components that they found that were the most sensitive and the most specific for determining the probability of falling over a 12-month period. Now, there's a lot of studies out there, different tests, different outcome questionnaires. You go to every place, you're going to find a different combination. Well, what they did is they found the ones that were the most specific and sensitive. So this is going to give you a more accurate measurement. However, it's also going to save you a lot of time because behind the scenes on these tests, the algorithms that are used are high math. And most people don't understand it. I'm one of them. And even if you did, it would take you too long to do. So now with the generation of the software programs, the computer does it instantaneously. So we do have her study. It's down here if you want to review that. We took it a little further. We researched area and we found the norms for not just 65 and older, but also from 20 to 45 and 45 to 60. So you don't need to be a geriatric person to run this test. You know, it's anybody who's at a risk falling. And then the final thing we did, there was a study that was put out just, I think, in the fall of 2022, where they just looked at the performance test, not the other medical questionnaires and the outcome questionnaires, and they wanted to find the validity of those tests. And I'll show you that we then gave the option, so it gives the clinician whatever choice they want. So her original study, which I'll open up, where you have now all the different choices of the studies here that you're able to choose from. Wait for my thing to open up. All right, well, I'll show her original one. So her original one consisted of 12 items, okay? You've got 5 medical history questions, and they're simply yes or no. Okay, it looks like our Wi-Fi here is a little slow. But these are the different options that you have. And we put these in there because there's different clinics, different places that want to streamline it, or some that want to get more detailed, but not where it takes you too much time. So the original one, which consisted of 12 items, which included the Berg, may take you 15 minutes or so to do the evaluation. We then put the option in there, which would be the second one, where we took out the Berg, okay? Because if people perform well on the performance test, well, they're going to ace the Berg. So, you know, they felt there was no need for them to do it. So we put that option in there. And then we went further with all the different performance measurements, because they found in that last study that I mentioned was that even the 3 performance measurements, which is called the SR3, it was as accurate, in some kinds even more accurate than the full ones. So this way we put these different options, whatever one you feel most comfortable, anywhere from a 12-item test down to a 3-item test. We gave you the option of choosing, you know, one or both of the functional the self-reported exams, and even the 5 history yes or no questions. You can even save them. If you say set this as your protocol, you don't have to worry about somebody going in there, because anybody in your clinic uses the R3 they would immediately come in here and it only show the test that they were supposed to take for there. So they don't have to go back and decide up here. But basically, you get the 5 medical history questions. Then we go into the 2 self-report. You got the GDS, which is the Geriatric Depression Scale, and the False Efficacy Scale International. Now, you have different ways of filling these out. You can simply come in here and open up the thing. They can answer it on the tablet. It will automatically score it. It leaves you an area for any comments. You can print out the forms, in this case, English, Spanish, or French. Most are just English and Spanish. Have them fill it out, and then you can enter it. And the final way, which can even save yourself more time, you can go to a portal, send them the 3 questionnaires in English or Spanish, send it to them, either email or text, and it will give them the questions. And again, they got to type in their birthday, so it's all HIPAA compliant, and they can answer the questions, and it will automatically populate above here. So even before you see the person, this part can be automatically done. Okay, so you got your 3 options there. And then the performance tests are very simple performance tests, one that every healthcare professional probably knows. They're basically the 5 times sit to stand, the single leg stance. When you open them up, it'll give you an image of it. It will give you the procedure here. So if you're not sure of the procedure, you don't have to go looking for it. It's right here for you. And then you can do 1 to 3 trials. And what it does, it gives you a percentile rank according to their age group, a functional category, and the percent deficit that they are from their age group, okay? And then it gives a fall risk based on its low, increased, or high. Again, it gives you the area to put in any additional comments of fatigue, pain, whatever it may be. We even added an option. Now, initially with the Luzardi study, you had to do 12 items, okay? If you didn't do them, you couldn't generate the report. But that's why we put all the options to do various numbers, and also a number where you can check unable. And what it does, it defaults it to 999%, less than 0.1 percentile rank. So you're still going to get a calculation and a probability, even though they weren't able to perform that particular test. With all our reports and all the tests that you do, they're going to have anywhere from 1 to 10 different references for each test that they do. And we actually went to Luzardi, called her up, and said, look, this we did with your studies. And she was thrilled. She said, wow, you took my study of research and made it usable by the clinician. I mean, we all want to do accurate tests, and we all want to, measure the progress, but you don't want to spend too much time doing that. You want to spend the time treating them. So with the development of this program, you're getting the ones that were found to be the most specific and sensitive. Not to say the other tests, that are out there are not good. These are the ones that through their research, they found were the best ones. And then again, we added the different cohorts. So you go anywhere from the 20s up into the 70s and 80s. And then we also added the ones where you can, choose just performance tests and leave out the questionnaires. So basically it'll come down to your own decision how you do that. And once you're done, okay, all I do is hit preview report. Okay, so all the math is going to be done automatically by the computer. And once this shows the report, I'm going to go back and show you an additional area that we added where you can auto-generate goals, interventions, and specific comments at a click of a button. So you'll get the report. And let me move this screen over here. It's covering up my... There we go. And it's going to look like this, okay? It's going to be very user-friendly for the clinician, for the insurance companies. Here's your pie graph from increase, lower, high. You can actually import an image of it. It will tell them each test they took, your score, normal score, and if you're below or above a certain risk of falling, and then a color coordinates that. But what it does too is it gives you the probability that they'll fall in the next 12 months. Then it compares it to the probability of somebody in that age group. So this age group is 17%. So that's 1.7 or 170% more likely to fall than people in the same age group. If you do a follow-up study, it will tell whether or not they improved or they got worse or stayed the same. But the next part, it then shows the actual test again, makes it easy for the caregiver, for the patient themselves, insurance companies. It shows the test, it describes the test, and again, non-medical terms. Anybody with a basic reading will be able to read this and understand it. If you test over time for that given test, it will then show you the progress that they're making over time. So are they getting better? Are they getting worse? It also kind of gears your interventions, because if I see he scores poorly on this one, I know I got to do lower extremity testing. If he scores poor on the dynamic gait test, the self-timed, I know it's more dynamic balance that I'm going to look at. For instance, for the single leg stance, so it's more static balance. So basically, you can get an idea of how to cue your treatment based on what you're finding. And when I go back here, here's where we did that. You can come to comments and summary. So essentially, all I have to do, once I do my test, it'll look at the outcome cert, it'll look at the performance test. I say auto-generate. Okay, now it's going to basically auto-generate the goals for those tests automatically. So you don't have to think about it. You don't have to time it out. Then you can go to interventions. If there was some deficits and they gave a goal, well, then it's going to give interventions. Then you can give comments. So I might have a comment made up for people who did poorly, scored poorly on this, and I recommend physical therapy. So, improve their balance, prevent bodily injury. And I don't want to have to keep typing that over and over. I can just put it over here, and then whenever that particular case comes up, I click it and it automatically types it for me. It always leaves you, where you can type your own information in there in addition or instead of. You can do time in, time out. You do have the referred by. You can put in diagnosis. It has access to the ICD-10. Basically, it's taken the fall risk, and there's actually a mandate by Medicare that they any patient should have at least one a year. Okay, so even if they're going to the orthopedic because they broke their arm, we have the orthopedist using this because if it hasn't been done before, and they'll ask the patient, it's mandated by the Medicare, so they can perform this test. You can do it in a PT clinic. You can do it in assisted living. But the key here is that you're able to do the test in a minimal amount of time. However, you want to make sure it's thorough. You want to make sure it makes sense and it's functional, but it's also got to be backed by peer-reviewed studies. So essentially, this covers all those. And again, we did speak with the people of these studies, and they were thrilled that, they did all that work, but, nobody had the time to do it in the clinical basis. Now you're able to do it basically with just clicks of buttons, and the testing time, again, average 10 minutes or less, especially if they're filling out the outcome questionnaires through the portal. So that's pretty much a summary of it. Is there any questions?
Nice, Bill. Thank you so much. Yeah, so Bill, quick question. This is how we look once we open the
When you open WebFC, I'll come from the beginning. So if you're on our website, you'll have to excuse me. We're at the conference now, and their internet here isn't too good, so there's a little delay. But when you first come in, this is what you're going to see. Okay, you can add a new patient. You can go in here. Once you've added patient, tested them. So I had D. Hannah up. I would go in here. Okay, it's going to give basic information. And these are all the tests that were done on D. Hannah. We did a senior fitness test on her. We did a fall risk, a health risk. There's the PDF. I can then automatically, I can go to email and fax. Look, they want to get their information right away. Click them a little note. You want that last fall risk I did on you? Fine. Or if I'm sending to the insurance company, to the caregiver, I click send, and they get that automatically. Okay, so if you want to do additional testing, which we do have, matter of fact, we have what's called the senior fitness test, where they can do a senior fitness test that's used in assisted living, just the basic measurements for the elderly, which would be right here, senior fitness test. We got the health risk assessment, so we call it the senior suite, where you can do fall risk, fitness level, and their basic health level, and it's going to be in a similar format. Will be all backed up by peer-reviewed studies and research, but we also have a whole, we have the functional capacity testing, we have fit for duty, we have employment, pre and post-employment, we have other testing that we have in here, and soon to come out will be standalone outcome questionnaires. Now in this one, you'll see them in the FCE. But, for a PT, OT clinic that just wants to do it for their therapy patients, you'll be able to choose your outcome questionnaire. Again, send them through the portal. They can fill them out at their own leisure. It will automatically pre-populate it back in, and it will give you progress for that particular outcome. And it'll also give you an overall self-reported disability if you do more than one. If you do 5, if you do 2 for that given day, it will give the self-reported disability that they have for that. So it was one thing that we've always had the request this day and age is the outcome questionnaires, which we always had. They were in the, in the fall risk and the FCE, but, people with just that don't do that and just want to follow their patients alone, they'll be able to do outcome questionnaires as a standalone testing. And again, any test that you do is always listed down below with the access to the PDF. Now, we also do offer through our IT system is they're able to do combine it with your EMR. They got SL7s. They got different ways to integrate it at request. Again, it's all done individually. It depends on hospital systems. That's what they want. A small mom and pop clinic, they don't need that. This is enough. But so we have both options, and our payment pricing is very simple. Okay, we either offer monthly, so you could get the 3 tests: the functional fitness, the fall risk, and the senior health risk. And basically, for $100 a month, you could do as many tests as you want. We also offer individual ones for per test prices. For if you just look, we're only going to do this a little bit. We don't need to get it on a monthly basis. Which really works out for the FCE. You can do it on a per test basis. For the FCE and these tests, you can do a group of 10. And again, they never expire if you do it that way. But certainly with these 3 different tests that you have, you do 10 of them. It's costing you $10 a test. Anything over that, and a lot of these can be done on a monthly basis. So it does give you a significant increased revenue, but it gives you the report generation, which was always what's lacking, as well as the the calculations behind the scene. This allows you to spend more time treating and less time testing and doing your math and coming up with plans because it automatically does it for you. Any other questions? Yeah.
Thanks, Bill. So, let's say we are in different setting, right? So I'm in acute care and there is a home health and outpatient. So what will be the best setting for this platform or web
Well, no, this is
software?
used, this software is used by anyone in the medical health field. We have doctors in their own doctor clinics that use like the health risk assessment and the functional fitness, because in here with the health risk assessment, let's see if I can open it up, we actually allow the doctor to put in his glucose.
Nice, yeah.
Can leave that out and just do the basic measurements. And so, they use this at health gyms, okay, that the high-end gyms, want to offer us an extra thing for their clients, and they just leave out, of course, the medical, the blood work, and they can get their reports from there. So, again, like recently, we've had a lot of orthopedics who, they're coming to them after surgery of a broken leg, broken arm, but they saw this as another source of revenue, plus helping the patient out and saving Medicare in the long run, so these people don't fall, is they can throw these assessments while the patient's waiting for the doctor to do it. So there is no restriction as to who would benefit from this particular software, because at every angle, it can be used for PTs, OTs, exercise physiologists, family doctors, orthopedists. We're finding that, at more and more avenues, different people are using it in different ways.
Yeah, so I can see that they can put their name there, your logo here. So
Yes, they can
put their logo.
brand it to them. It's never branded to us. It's branded to your logo. You can add it, your own, as many people doing the test, you can add them over here. You just go to company details. So if you have more than one clinic, you can come in here, set up each clinic. You can put company details. Again, if you have 2 clinics that have different logos, you add a logo for each clinic. You can put the location of the clinic in there, and then you can add all your users, okay? However many you have. Now, say that person leaves your company, well, you can deactivate them. So you're able to, gear it towards you. And one other thing I'd like to share with the program here is we have a patient portal now where the patient can go in, access it, and get their tests and copies automatically by themselves, just like the hospital systems do. When you had a MRI done, you're able to go in there and get it. Well, you can go in there and get it for the patient portal. Or if you're an organization, a company, say a truck company down the street that's sending us a lot of people, they actually can go in there, see if the person showed up for their test, schedule a test if you allow them to, and then get their results right from there without having to bother the front desk. So we do have portals in here that allow you access. Now we also have, we have courses. We got people looking to do FCEs. We have an FCE course. You get 7 CEUs. There's a certification test. It's 100 questions, 70% pass. You can take it as many times as you need to pass it. It allows, it actually helps you study it. But we also have that for the health risk and the fall risk. Again, you can get a couple credits for those, and there's examinations for those. So it just helps you learn it. We do have all the manuals are over here. And here's actually the best practice guidelines for the FCEs put out by the APTA in April 2018. And then we have it where you can send out marketing materials. So if you're going to do the fall risk, you would open that up. You can send these out electronically. Again, we put your logo on there. For any of these different tests that you have, you can, or you can have it in your office. They're just simply sitting there and they can grab it on the display. And we even have short PowerPoint presentation. If say you want to go to another doctor's office, to an attorney's office, to a workplace, and give a brief, demonstration of, this is what we're able to do for FCEs for your company. So we have it every way. We always have training here. So this is for the FCE. You can get this training right from the FCE, or you can come in here and it goes over each section. Now we hold demos. So for anybody who's listening, just mention that you heard us today. And when you go on our website, which is simply webfce.com, it allows you to schedule a demo at your time. Could be in the morning, could be in the evening, could be late afternoon, whenever you want. Basically for the fall risk, it's gonna take about a half hour. And let us know. And since you listen to us here, we will give you a free month trial, unlimited uses with the test to see if you like it. We don't have contracts. We don't have setup fees. Basically, it's if you use it, you get charged. If you do per test, you only do a few tests, fine. That's what you get charged for. There's no need to put all these extra fees in there, to nickel and dime everybody. We just try to look. We're trying to get this out there, trying to people, to get to use it. And we're more and more, we're finding that since we're so research based with from peer-reviewed magazines and studies with all the references that go with it, people are coming on board quicker and quicker.
That's nice. So, is it like there's a reimbursement for this, or this is cash pay for?
Oh no, you can reimburse. So for the fall risk, you're going to use the same code, the performance code, the 97750, and basically you can get 2 units out of that. For that test, because you're doing all the other assessment, they're only taking you a few seconds to generate them, but you can get 2 units. And FCE, you might be able to bill up to, since it's taking you several hours to do the FCE, the report's generated in a matter of a minute and a half. You can bill up to 16 units. And again, it depends on which state. Some states you get a little more per unit than others, but for the time that it's taking you to do it, and it's accurate because all the calculations are done by the computer, you spend more time actually treating the patient, which is which is what we're kind of all hoping to get. We don't get bogged down with paperwork.
What's that? Do you have any therapists like concierge or any maybe therapists that they're just doing cash pay, and what's their feedback?
Again, yeah, there's some places, say for the health risk, the fall risk, especially the health risk and the functional fitness. Maybe you don't got an injury. Like I say, a lot of the some of the gyms use it, the fitness centers, and they charge a cash basis. Depending on what you do, how much they can charge anywhere from $35 to $70. And then, depending on the area where you're at, people, they don't blink at it. Okay. They
Mhm.
see the reports and, it motivates them because everything's explained to them. It's, it's all colorful. It's all, but it explains how they're doing. They see progress. So there is cash bases that, people around the country that use. And, if you schedule a demo, Drew, who's normally on me with the demos, can go more over that with you, but you can
Yes.
do these on a cash basis. Some places, look, we only do cash. We don't go through insurance. We don't like it.
Yeah.
We're like, fine, you can set your own fee in your area and see how it goes. It's wide open. So you can bill it through insurance, you can do cash, that's totally your option there.
Thank you so much, Bill. Bill, how much is this? Because some of the questions also the cost.
Okay, it depends. If you're doing the
Okay.
fall risk, now if you're doing the fall risk, you generally get the fall risk, the senior fitness, and the health risk. Now that could be $100 a month, unlimited testing, unlimited people doing the test. Or
Okay.
you can get charged a per test fee, like we want a group of maybe 10, 20 fall risk, and then you got them until you use them up. You can always switch plans. Again, that might be $10 a test, and then you might find we're doing enough of these where we can go to $99 a month, and you can switch at any time. There's no cost, there's no issue. You just call Drew and he switches your program. Now the FCE kind of works the same way. That's an extensive test. You can buy per test. Now, some clinics, well, look, we only do one or two here or there, maybe one or two a month. We want to get into it. Well, we have, it's $89 a test, but you're going to bill out $600 to $1,000 for the test. Or you can buy groups of tests. So if you want to buy 5, okay, it drops it down to 75. They don't expire. So if it takes you 5 years to use them, it takes you 5 years to use them. If you're doing more than 2 a month on FCEs, it's $99 a month, which then drops it. You can't lose. It's dropping it down to $50. If you did 10, it's $10. But you also have access not just to the FCE. Now you got access to the pre-employment, the post-employment, the fit for duty. CEU testing here. Normally it's $4.99 a month. If you just come in and say, look, we just want to learn about FCEs. We don't want to program. We just want to get some credits and we want to learn about FCEs. It's $4.99. If you're a person that, look, we got several people in our clinic where we want to do the monthly basis, you can, we can drop the price down from $4.99, maybe $2.99. So they're very open with the pricing here. There's no set. If you wanted to do all our testing, okay, then the educational becomes free. The testing's free, and you can do any of the tests. You can do the fall risk, the functional fitness, the FCE, the pre-employment, every test that we have. Certainly if you're a big, busy clinic, it behooves you to do it that way because then you're getting charged minimal for what you're doing. You have access. Again, some people like starting out slowly. Look, we just want to try your fall risk and see how that goes. Okay, fine. But at any point, you can call Drew, you call myself. If you have any questions, once you get it, we don't leave you. You can call us as many times as we want, as you want. We have some people doing the FCE that call us on a weekly basis. So we do answer any questions that you have. We have fun when we do it. So we like doing it. We encourage people to do it. And again, we do these demos. When you see the demo, we'll go over a little bit spaced. Ask more questions, especially when it comes to some of the other testing. The fall risk is pretty simple. But again, they will allow you to just tell me you listen to this and they'll give you a month free. Do the fall risk or the senior fitness or the health risk assessment, see if you like it. And then again, at that point, you can say, that's not for us, or yeah, but we'll just we'll buy a few at a time. And then if it's really taken off, you go to the monthly basis because that just saves you a ton of time, a ton of money doing it that way.
All right. Thank you, Bill. So this is great. At least we learn a lot regarding the in-depth for this web FCE and what are the involved tests. And I didn't know there's more courses, certification. So this is great. And we will connect. If you can, please write Drew and your contact information on the chat, Bill. And congratulations and good luck on your presentation there. Are you in Texas?
And thank you for allowing us to come on
You're
board.
welcome.
And thank you for whoever's listening. And I'm sure you will You will find this very beneficial to your particular practice, both on a clinical aspect as well as a monetary. I mean, it is a business. This helps you in every aspect. It's just simply webfc.com. You can contact either again, it would be Bill at WebFCE. And Drew at FCE. He's the main guy to contact. When he can't answer it, he just contacts me, and we can do a screenshot at the time. So we're not just going to talk to you. If you feel that you need to, let me get here.
And if they want the trial,
Yes,
how
all
can
they do is let us know
request?
when they set up. Say, look, we were listening to you on the thing. We're like, fine. When we get done, Drew will give them access. No obligation. They'll have access to use it. You know, after a month period of time, and if they feel they want to continue to use it, they will have it. So
Yeah,
when you
and
go to
are these
webfce.com, that's where you'll be able to schedule the demo. When you open that up, it'll see right on the front page, schedule a demo. You pick your time. Basically, if you just want the fall risk, it's a half hour, depending on what test it is. And again, you can say, I want to do the fall risk, but the time you get on, you say, no, we decided we want to look at the FCE. That's fine. I mean, we just put that in the basis. The FCE usually takes maybe an hour to get over it, kind of thoroughly. It's because, as you know, if you do FCEs, are a bigger animal than these other tests. So that's not a problem. It's basically just scheduling yourself a time and letting us know you got a half hour to spend with us, you got an hour to spend with us, because we can do the FCE in a half hour, to be a quick preview. If you like what you see, you schedule again, and we take hour and a half to go over it in detail.
Yeah. And Bill, quick question here. Are these tests apply to any age group?
The fall risk initially was when it was done by Lasardi, they used 65 and older. The fall, now we've got the different cohorts. So it's 20 to 45, 45 to 65, and I think 65 and above. The functional fitness, now the senior fitness, which is taken from the functional fitness, but we took it out because people don't want to decide which one was for the senior fitness. You do the functional fitness, that's anywhere from 18 up to in the 90s. Okay, and of course in FCEs, whoever's working and get injured or applying for disability, they can use it for that. So we do have all age groups, even with the health risk. You enter the age, and based on the age that you enter, and many times the sex you enter, male or female, it'll base your results on the norms for that group. So you never have to worry about, what do I compare it to here? The computer sees it and does it automatically.
All right. Any more question, guys? Bill, where are you again? Are you in Texas?
We're in Austin, Texas at the PPS, the private practice meeting section. And this is our 5th or 6th year, first time here in Austin. So I ran over from the conference over here to do this from the conference hall.
Yeah.
So I appreciate the opportunity, and I hope people, I know if they take a look at this and use it, they will like it.
Congratulations and good luck. Thank you so much for your time, Bill. This is really great. We will look forward on learning more, and we'll connect and check the website. Thank you so much.
Thank you for giving me the opportunity.
You are welcome. We appreciate your support. All right. Thank you so much, guys. The Web FCE and also their email are all there. So you can really personally ask questions to them. So Drew and Bill, they can answer your questions, even it's more technical or just like more on the business side. The good thing is you have a trial. And I think they even have some team member that sometimes they can connect and ask for trial if ever. All right, just connect, tell them you watch the Geriatric Rehab Summit and the Innovator Summit. Web FCE also is our sponsor last time in the Geriatric Rehab Summit. So we appreciate your support for us. And then also, guys, these are all in different setting as you are in healthcare clinicians, I can see this as like if you are doing your own Like even you don't have a clinic, you just have your own practice, like even a concierge basis. Concierge physical therapy, even you're going anywhere, you can partner with a gym, you can go in different offices, just you have your own LLC or
Exactly.
business. Then you have this software. And then you just need to have your own website or marketing that you are doing this as a functional event. And then you just itemize all the services that you're planning to do. And you can get it from the different, when you check the home, you can really choose from all of those. So imagine you're doing a full risk assessment, health risk assessment. I can see this like doing a fair, like joining and making like a marketing, like go and market that you are a physical therapist in your town and you're doing a full risk assessment. In although of course this is not free, but you can do it in a way that you're marketing, that they can come to you and you can do your physical therapy service, you know what I mean? Or maybe you just make it as a minimal fee. So it's all up to you, but I think that's a great way of marketing your clinic too, or your
And
practice.
I did want to add, we are about to add, we have the goals, the interventions, but we're also adding the home program. So we're going to have, or you can click and send them the Otega. You can send them a house assessment to, make their house safe, exercises that you can send to them. So it's going to be automatic where you can click these, just like we have the interventions and goals,
Mhm.
you can click the home programs. That's coming out within a matter of a week or two.
Wow, that's good. So we have Otago certification, guys. Check that, and then definitely you can use also these services and their resources. That's really good, Bill. I'm sure that
Yeah.
it's coming from different clinicians giving some feedback. So if you
Oh,
check
we
the
base our stuff on the research, but we base it on the input from everybody who's using it.
Yes. So if you trial this and if you wanted to add more or looking for more that you might benefit, so they will be always like 2.0, add on different technology and
Exactly.
innovation. So thank you guys. Thank you, Bill. At least
All
the
right. Thank
Wi-Fi
you.
is great. You
Thank
survived.
you.
You survived.
All right. Thank you. And thank you,
Yes,
everybody.
you are welcome. So
All righty.
Nadine said wonderful app and need of all right. Thank you so much. Yes, yes, of course. So at least we have an opportunity to trial it. And I'm looking forward for those certification and coursework. Okay, okay, guys. So we have 15 minutes break. Do your lunch, not really lunch, it's breakfast in Philippines, or in Pacific, it's it's really early in Pacific time. Eastern time is dinner. So just giving you a 15 minutes break, and then we will have our next speaker. Sheila is a figure skater, and she will going to share her balance and vestibular training skills for us. All right, see you soon, guys, in 15 minutes. All right, thank you. Thank you, guys. So see you soon. All right. Take a break. Mon, you said there's no audio on the video that I just play. So let me check it out. Because I hear it on my end. Oh, okay. Let me try it again.
Hello, I'm Dr. Kim Rutherford, Vice President of Education here at the American Institute of Balance.
This year, we proudly celebrate our 30th anniversary as the proven leader in the evaluation, treatment, and education of vestibular and equilibrium science and concussion management. To date, AIB has trained and certified over 20,000 practitioners worldwide, with 1,200 rehabilitation professionals trained last year. We are honored to be the largest postgraduate educator within equilibrium science for rehabilitation professionals. AIB is excited to offer comprehensive certification courses, incorporating online and live education platforms to deliver a quality educational experience. This allows the clinician the flexibility to complete the online portion of the course at a self-pace without the scheduling demand of a predetermined scheduled workshop. Additionally, the live hands-on component gives the clinician the immediate skills needed to quickly and efficiently manage their patients in an evidence-based, practical manner. The reviews are in and the feedback has been overwhelmingly positive. Participant feedback helps ensure that we continue to deliver a quality product for clinical success and excellent patient outcomes. On behalf of our entire team here at AIB, I want to thank you for your recent and past support. AIB remains committed to you, our friends and colleagues, to provide an exceptional educational experience to help you better serve your patients.
Please visit Dizzy.com for a complete listing of our certification workshops. We look forward to seeing you in 2022.
All right, guys, take a break. Thank you so much.
I had a dream so big and loud. I jumped so high, I touched the clouds. Whoa, oh, 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 oh.
20. Perfect. But when I expanded the company in 2020, the fun part was everyone's like, oh, don't do it. You know, like you're already number one in sports. Like why take on something much harder for that general population? And we did. We still did it. And in 2020, that wasn't a great time to expand your company. But the fascinating part is people really gave me their time. So I'm going to show you just some of my really crazy videos to start out with. And then, of course, I'll work into my more proper aging ones, but I just like to kind of like freak people out early on. So I'm going to share my screen here at the beginning here. And I recently was in Australia presenting. So of course I have a really, really busy desktop. I'm that person. I'm so sorry. I'm really that busy. It's a little whiteboard. How fun is that? Oh, I don't know how to work a whiteboard. Here we go. Hold on, let me share screen again here. Hold on, I can do this. Oh, a whiteboard. How come optimized? Okay, hold on. I just have to figure out how to work a whiteboard here.
I think you click the whiteboard. You don't need a whiteboard, right? You just
I don't. I just want to show video.
Yes. So you need to just share all and then look for that video. I think you click the whiteboard. That's why it pops up.
Okay, hold on. Let me back this up here. Hold on.
Yeah.
Hold on. Let me try this again here. Share screen. Here we go. It's only giving me a whiteboard option. I don't want that. Hold on. Share screen. Oh no. Files maybe. Oh no. Hold on. Advanced. Video.
Yeah.
Here we go. Here, I got it. There we go. There's hope for me here. There we go. Share. Oh, this is so weird how it's doing this. Recent desktop. Here we go. Oh, it's giving me so many choices here. This is really weird. I've never had that before. Desktop. Hold on. Oh my goodness. It's never asked me this many questions before. Oh no. Share. Hold on. Video. Share. Okay, here, this is really an interesting way that it's having me do this here. So, okay, all right, so let me pull up my video of my really famous video that I love. Oh, here it comes. There we go. Can you see it? Oh, here we go. Oh, this is lovely. Here we go. It's just gonna be a little different than I'm used to. So this is my really famous video of one of my athletes. She's gonna do 100 on the speed spinner. Here we go. 1, 2. That NASA went crazy for. They went after, look at this girl. Oh my goodness, it's absolutely insane. And she is turning about 5.5 turns per second. And this girl is just a ninja at this gear. And it's fascinating to see her. She's got axis, balance, proprioception, midline cross, all these really important brain pieces. But at the end, she's going to tell us she's not dizzy. So here she comes. Ready? And then, of course, the most amazing part to the whole story. Okay, how dizzy are you?
I'm not dizzy.
Not that dizzy. Not dizzy at all.
I'm not dizzy.
Thanks. Have a great day from Vestibular Training Services. We have David. I just laugh at it every time. The kid is like, oh, I'm not dizzy, because we've trained the dizzy out of her. And that's what we're talking about. And this is how we apply this all to the general population. So I'm going to keep screen sharing here. I'll look at this. I have so many great videos here. Hold on. Ooh, this is really interesting and how this is making me go through it here. Hold on. So this next one here is a famous doctor, and it's Dr. Andy Beltz, and he is actually, try a different file. Why won't it like that file? Hold on. Let me try it again. Share screen. Oh, how interesting that it's fighting me on this. Oh, interesting. It isn't liking this file here. Oh, okay. Hold on. This is really interesting that it's making me do this. Oh, interesting. Okay, so let me try this with Dr. Andy Beltz here. Oh, it won't play. Oh. All right, I'm going to move on to some of my other videos. So we have, we talk about vestibular, we talk about balance, and really the biggest 3 and 4 things that we can talk about when we talk about vestibular is 1, balance. So that vestibular system is really connected to my balance system. And I always talk about when it's working great, it's almost like a low running app in my brain. But when my vestibular system is off, it becomes a high running app to the point that other things aren't working well in my brain. So my vestibular is tied to my balance. It's connected to my cognitive processing. So how fast the information is coming into my brain. And additionally, it's also connected to non-spatial disorientation, which is really key as we age and as we are drivers, as we drive a car, much less fly a plane. These are all these pieces of information of non-spatial disorientation, even for athletes. that they have to know what's going on really around them at all times. And then the final thing, the vestibular is the top 4 things. There's like 20 things that are tied to, but the other one is sleep. And when we talk about the importance of sleep, I just think that this is really that information is coming to the forefront of the importance of sleep, of it allows our brain to clean itself. And it's also tied to emotional regulation, because think of all the times that you didn't get enough sleep, and that's when you were possibly the most emotional. And I talk about that all the time too, for when my children were little. When my children were little, I cried a lot. And now that my children are adults now, I don't cry anymore. Like it's really kind of nice to see that because I'm getting enough sleep, that emotional regulation all ties into it. So I'm going to move on and just show some, hopefully this will let me keep showing more videos here. I'm going to share some screen and some more videos here of my favorite person. And I always want to talk about is my mom. And my mom is here, moving videos here. This is really weird that it's not letting me run these videos. This is really, I find really interesting. I'm sorry. Like I really don't understand why it's not letting me play certain things here. Oh my God. Why won't it do that? It's really fighting me on my format here. So you know what I'm going to do? I'm just going to, I know this sounds really weird, but I'm just going to show it on my phone. It's really, the Zoom is fighting me here tonight. So I want to show some videos of the aging process, and it's my mom, and she's 78 years old, and it's really getting harder and harder for all of us to, to stay moving and to really balance through this process. So I'm just going to quick show some videos of my mom on the gear. And I think that it's really important when we talk about balance, we also talk about the fear of falling, and I think that that's really important stuff. So I'm just going to start it right here. And here we go. Come on, play. Here we go. And you're going to laugh. Here's my mom on our new rail system. And with that, she can just step onto it, and it's very easy to run. I have 8-year-olds that run this gear for their families and stuff, but it takes away the fear factor. It's not the flying motion like what we saw on my crazy NASA video, but you'll notice she can hold on. She's got a waist belt on. Very easy to run gear, and it's nice and gentle. It's not scary. It's not like, oh goodness, it's not like a tilt-a-whirl like the children enjoy. So with this, it is something actually really realistic for the general population. In addition, you'll see my mom, she crossed her hands. So we talk a lot about crossing that midline. And I think that's really important, because if your left brain controls your right side and your right brain controls your left side, crossing your hands and getting both sides of your brain to connect together are really key factors. So you can see this is super gentle. In the end, my mom's going to do about 8 turns each direction and then rest. So she'll do it 8 turns counterclockwise. Then she'll rest for a minute. We'll chit chat. Then she'll go 8 turns clockwise and then 8 turns counterclockwise, and she's done. So really, the whole goal of this vestibular training is it really only takes about 5 minutes. And that's what we're really excited about within the company, of that it's gentle, it's easy. It's something that can be done in the home. It can be done in senior housing. You could put several units of these together, and people could hang out and do it together. It's a very gentle, fun process. And I love to sit and chit chat while they're doing it. So that's such a good video of my mom. And I also want to go back to even her friend, who also used the product also. Same thing is that she could just gently turn. And once again, you can start out holding on, and there's that really comfortable waist belt, so you feel safe that you're not going to fall or tip while you're doing it. And it's just this gentle turning that I think is really key in just really helping reset that vestibular. So everyone that works with me, I keep going back to, it's very gentle. Nobody vomits. I get the question all the time, do people vomit? And the answer is no, absolutely not. We don't want you to vomit. So it's gentle. And I really do have several people that do just 1 turn. And that's as much as they can handle in through the aging process. But it's these gentle turns, and it's part of that whole vestibular system and helping reset it. And everyone talks about what better sleep that they get. So better sleeping, of course, is really part of the brain healing itself and cleaning itself, every night. So it's enjoyable. And this is actually one of our friends who has actually chronic knee problem, and talked about when she was done, she didn't have the knee pain because she really felt like her brain was running you can feel the vibrations of the spinner up through your feet, and just really felt the proprioception go up into her brain. So I want to this is such a crazy way to do it, but I also want to go back to what I call my reality videos. And this is another one of our clients that really has had a lot of falls. And since she's been working with us, she hasn't had any falls to my knowledge. And with that, she's going to do just one turn. So the gear does go up to 350 pounds, which I think is important for the general population. And you'll notice as she does this, she is doing the work, the horizontal, the vertical, the yaw. She can move her head. She can, talk. We can communicate. And all of this work is being done on her feet. And the concept of learning on your feet versus sitting on your butt is two totally different learning curves. And they're even seeing that in children right now. We talk about that in the education system, that children sitting all day aren't learning, that children that are up and moving are learning. And that's how we as humans learn. So I'm just going to keep going. This is such a crazy way to use my phone to do this. Sorry, but yay technology that fights us on a daily basis here. I want to move on and just show some of the work that we've done with concussions, and this is one of our favorite clients who has had a traumatic brain injury, and he'd seen the children fly. So he'd done 2 sets of platters, but wanted to try the fly motion like he'd seen the children do. And after a 12-year brain injury, we pre and post tested his balance, and he improved his balance by over 50%, which is shocking even this many years after a brain injury. But the really fascinating part is, one, he has paralysis on his right side, and he's going to come down on that right foot and not even realize he's stepped on his right foot before he shifts to his left foot, because I really centered his brain. So to see the improvement, even after just 5 minutes, are really part of what we're so excited about. I also realized too, in our little write-up, we recently did get our patent. So it says patent pending, but we recently got our patent. So all of our exciting work within that is so exciting for our company. So as we talk more, I just want to see if I can get just one more video up here in my phone, because it's such an odd way to do this. But I really feel like we can look at all the different ways that people can balance and improve their balance. And it's such simple ways in how we can make that work within our brains. I want to show another one. Okay. Oh, I have so many good videos. It's almost hard to decide where I should start here. So many good videos and my favorites here. So this one is actually, I'm going to turn the volume up, because this is actually one of my former students that now flies Army helicopters. But she's talking about non-spatial disorientation, but she's really also talking about flying helicopters and aviation. But as she's saying that, also in my head, I'm hearing sports, and I'm also hearing driving, especially as we age, talking about driving and that non-spatial disorientation. So she talks aviation, but we're going to also talk about driving.
So being a figure skater, it completely changed my life with aviation. The training I received through years of skating made me basically immune to spatial disorientation. They've put me through every test, every Blarney chair, every spinny apparatus, the spatial disorientation pods, and I cannot get disoriented. I always know where my body is. I always have a sense of where the ground is, how to right myself, and also the mental clarity on how to stay calm. And that all came through skating. It all came through the years of spinning and coming out of a certain position, spinning and with my head in different ways. And it's literally going to save my life as an Army aviator. And I feel like vestibular training could save the lives of all aviators, because you can train spatial disorientation out of you. You can learn to not get spatially disorientated. It is a learned, practiced skill that is possible.
Which is so nice. Like look at how that applies to all of our lives in driving. It's my favorite example. So of course she also sent over these videos of what they call the Barney chair, where you sit and they spin you in the military in how you come out and not be dizzy. So I'm going to quick back this up here, because she starts off with a boy who's terrible. Look at this boy. He's just, he's about to get kicked out of flight school, and all that money's wasted because he's so disoriented from the spinning motion. Whereas we have my girl, Megan, who this is slow. When you saw my fast figure skating video at the beginning, this is nothing to her. This is so slow. But when she stops, she's got perfect balance, to the point, who do you want to fly with? I want to fly with Megan. That's who we want to fly with, not this boy. Okay, this is not who we want to fly with. So I love watching this video even twice, just to really see what's happening. That, you know, a figure skater, and with that heavy vestibular training that she's received all these years, you can see how that really affects her daily life and all of our daily lives. Once again, who do you want to fly with? It would be her. Once again, oh goodness, that's what we're looking for. So I want to keep going back to the importance of balance and how that all affects all of our brains. And I think our quality of life. I often compare it to a running app, but at the same time, this is training that is so easily done. Although we have a balance mat. We work with a company called Body Tracks, and they talk about, we do 10 seconds eyes open and 10 seconds eyes closed pre-testing. Then we gently spin and do our spinning harnesses. And then we go back and retest. And what differences we see in people's balance in that 5 minutes. But the feeling that the people have is instant, you know, and I get the question all the time, how long do the results last? And the answer is the results are instant and immediate. And what it really feels like is once you've been spinning on it and we stop, is your brain goes, I use a sound effect. Your brain just feels like it comes to center, and there's an alertness there. It's that faster cognitive processing. But from there, the results last about 3 days. So people talk about being alert, feeling like they have spidey senses, super strong, super alert, and they just know what's going on around them. From there, the results last about 3 days. So most people work with us 2 to 3 times a week. My athletes do 7 days a week. So it makes sense why they train that much. But in the same sense, at the 6 to 8 week mark, it really sticks. So that's where a lot of PTs and OTs talk about therapies, really, that there's something magical about 6 to 8 weeks in humans, that things really, really stick. Then at that point, a lot of my clients just come back every other week, once a week, every other week. But the interesting part is they all enjoy it so much, they still want to come back 2 or 3 times a week because they really do enjoy it, which is always a good sign when your clients don't want to quit. They still enjoy coming back. So the other piece of this that my chief medical officer, Dr. Daniel O'Brien, who's based out of St. Louis, talks about all the time, he refers to it as plug and play. So for a PT or an OT, basically to start out with this in the beginning of the session, just for 5 minutes, and then move on to all the other laundry list things that you want to do with that client. So you can do 5 minutes of vestibular training and then go work on other projects that client also needs. And it really makes it, it's just you plug and play and just keep it moving. In addition, we also have our chief medical officer, Dr. O'Brien, but we also have our chief PhD research coordinator, Dr. Erica Olson, based out of the University of Minnesota, that is teaming up with us in writing papers and coordinating all of our papers worldwide. There are approximately 50,000 papers already published on vestibular that you can look up on pubmed.org. So you can just search vestibular and up will pop 50,000 papers already published. Just read for a couple of years. Enjoy that. Keep reading. Enjoy that. In addition, we have several papers coming out specific to our product. Actually, in the next couple of weeks with the British Audiology Society. Oops, wait a minute. The British Audiology Academy will be publishing a poster and some other projects with us in upcoming months. We have several researchers in the UK that have been writing papers for us. So this is where we can all grow, and this is where we can all really win in helping products really come to market. In general, these products really do take 17 years to come to market. And this is where I always look into the screen and go, it doesn't take that long to come to market. And I think it's the coach in me that's like, TikTok, we're doing this. We're moving way faster than that to be able to bring these products to you and available to the general public. I have a very large client that will be announcing in mid-December, early January, that will be in 200 locations worldwide, or excuse me, nationwide here in the United States. We do have product worldwide already, even including Mumbai. So if you're in Mumbai, you can for sure be using our product. In addition, we also have other major projects coming out in the next 3 to 4 months. So be watching our website at spinyourbrain.com to be seeing all of our new locations that we'll be going out to. So lots of information that'll make it easier and easier to come to you. So hopefully we can get everyone gently spinning to help improve that balance. Does anyone have any questions? I'm just seeing, here, I see a couple of questions here. Go ahead. I mentioned autism earlier in the presentation. How can training help these children with autism? And I have to say, it's very exciting. We're close to an NIH grant on more research. We are in several autism programs throughout the world, and the children have really, it's heartwarming to see how the children have really been improving on the gear. Both emotional regulation, and the children really enjoy it, especially children in spinning and autism. But there's something different. And I always want to also talk about this. In me just standing here and spinning myself, I'm in control of that, which is still a benefit to my vestibular system. But when you're on our gear and your brain has to react to the spinning that we are spinning you at, it has different results. When you have to react and compensate to the velocity that I'm spinning you at. And obviously it starts out slow with the gamification of it becoming faster and faster. The brain has to react to it. And it really has two different sets of results. Of course, spinning yourself is great, and that's a really good start. But in the same sense, these children with autism are showing stunning results, even in their sleep and that emotional regulation. So we're very excited about that for the children, because not only helping the children, but of course the entire family, which is once again where society really can benefit. We do talk about half our sales going to people's homes, which is great. That's nice. But our real goals within the company is to get it in the hands of a good PT, a good OT, because really one unit can help 1,000 people within the community just in having it with a really nice access, whether it's a community center, a workout place, a good PT, a good OT, schools. We're really excited about going into a lot of schools in what that can do in its accessibility to our population. Does anyone else have any more questions? I'm just seeing more pop up here in the chat here. Oh, no, I think that's it. This is pretty easy. I also do a lot on LinkedIn, so be sure to follow me on LinkedIn, Sheila Thielen. And I also, one more time, our website, spinyourbrain.com. And I can even type that in here, spinyourbrain.com. Oh, there we go. If I can learn to type, here we go. And I invite anyone to connect with me and ask additional questions. And I can't thank you enough, Dr. Joseph. This is such a neat opportunity, and we're truly grateful for this opportunity to present tonight.
You're welcome, Sheila. This is really interesting. I saw already two different technology, right? The rail and then the one, what do you call the circle? Just, and then they have a
So the fly. So we have two units, and basically one we call the fly system, which allows, you know, and I think that's great for athletes and children, although you still have the option of not flying on that one, but it feels a little more scary to the general public because, you know, there's nothing to really hold on to but the body harness. So you're still safe in it. It just doesn't feel as safe to you the first several times you do it. Although I do have to say, when that was our only product, people adjusted. It was fine. Like, they all adapted, including amputees. Like, amputees still did really well on the gear, even without the rail system. So, but the new rail system just came out about 2 months ago. And so that is now available too, but that just feels so safe, especially to my older population. Anyone, to be honest, it just feels really safe to be able to hold on and to step on a little safer, feels better. I do have to say, the one downside of the product is this really is standing balance. If you're unable to stand, we're not the product for you. There's other great products out there that will help you stand, but that isn't this product. In addition, we have we've been working with stroke patients, Parkinson's, Alzheimer's. But I'm also going to say too, there's also a point that we've only gone so far. At some point, we really have hit the point that the patient has really gone and progressed too far, that we really don't think we're helpful anymore. And that's the part of all of the brains that we work with. But at some point, there is a percentage that really we are unable to. So, but you really need to be able to stand. And that is kind of the downfall of the product. But there are some other great ones out there.
Nice. Thank you so much. So you're saying that these two platforms, let's say technology, is like available for out there for sale, that they can use. If there's a therapist, they can even use it in different setting, or if we know somebody in, I think this can be in a facility, like if you want to train those older adults, something like that. But how can they earn money if ever they have this? Do these patients pay for that training because they are being trained, or how does it work in the business side if they bought those?
So my understanding, I go back to, remember, I'm not a PT and I'm not a doctor, but my understanding is there is a rehabilitation code for vestibular within the system that they can add in for rehabilitation for vestibular. Also assessment, so like the balance mat, you know, and really this is just 5 minutes. And people are always amazed when I say, like, I just charge $10, you know, to come in, spin for those 5 minutes and come in and leave. So I have 50, 60 people can come through in a day easily. And I just, $5 to $10, like it's I really keep it affordable. And with that, it really is gear that can be built back within the codes, is my understanding for insurance.
Okay. So if they have those insurance, Medicares and everything, it can be billable under those codes. So that's for the therapist and business standpoint. And then when you say they bill like 10, so they can do also cash base if they want to or something. So that's really good. At least we know. And how much does it cost? Fly versus rail?
So basically the fly system runs about 13,000 and the rail system runs about 17,000. And the one nice thing about the rail system is you just plug it into the wall. It's that simple. Plug it in, set the dial, step on the pedal, you're done. Like, it's very, very easy gear to run. The fly system is also easy to run, and there's also a triple pulley in it. So I always talk about, I'm very small. I'm 4'10". I'm just really, really short. And I recently picked up a 261-pound special forces soldier. I got him off that thing. I flew him, and we had a wonderful time. It was really an easy product to run. I'm also seeing notes, of course, about the astronaut programs. Absolutely, and we have done a small project with the head neuroscientist over at NASA, talking about dizzy astronauts, and of course using our product too. And I also see that there are spinning and simulation of vestibular systems can be done in sitting or supine. Absolutely. You can also use our gear with the head in different positions, even while spinning too, because you do have head movement within the gear. So, even people with crystals, they really can help that process also. There are also spinning chairs out there, that's a whole nother product that isn't ours. So there are spinning chairs out there for those that can't stand, but that's not our product. You'll find that somewhere on the web.
Yeah, I think the figure skater, the astronaut in NASA, the ones they're sitting, and then that's another training for them. What do you call that again? The sitting.
Yeah, I'm just they called it a Barney chair.
Barney.
It's called a Barney chair, and looks amazing. I've also seen they're like $500,000, like these big like NASA chairs that you get strapped into, and then they can flip you like a NASA astronaut. They look terrifying. Go ahead and sign up for that. Tell me how you feel about it. But I think
there's also like the if we just want to play and improve our balance, like the balloon, we go inside.
Yeah. Can you imagine? Yeah, like that looks terrifying. It's super fun. Like there's the batch that can still do that. And then there's the batch like, yeah, I'm not going to do that.
So we can say, is this runs for the principles of habituation, because we just want to make us to be more dizzy, and because dizziness makes us dizzy, we need to make you dizzy. You know what I mean? So is this runs on that principle, because that's what
which sounds weird. Like in the group that's the most afraid of me, of course, are people that have vertigo. They're like, oh, I can't, the thought is horrible. But really, part of it is the more we move our head, the more that vestibular moves. And as we age, that's what we stop doing. And that's what all the kids' problems are these days, is they sit and look at phones and tablets all day, and they don't move their head like children should. And my example of that is always, if children how do kids get on a couch? Flip, like all the ways that children get onto a couch. But as we age, how do we carefully get onto a couch? Very carefully, with very little head movement. We're going to sit carefully, and I look at the more we can move our head, and that's really what we are doing in that harness system, is we are moving this whole system. It really helps crank on it and reset it. And to apply sports training to the general public makes sense. Look at I talk about the ninja athletes I'm creating that really we can use that technology for the general public.
Yes, that's really true, because for me, I always easily dizzy, and then just changing position and everything. And then I have a friend, when we attended the vestibular rehab course, and then we're afraid to be a patient. And then I said, I don't want to be a patient, because, they will play on your head, and then when you're done, they will be like that. So we can say that we need to be more exposed and keep doing those and those. That way we improve that those crystals to be in position, right? The saccules, utricles, and everything.
Absolutely. And these are the pieces that are just so, it's easy. Like, it's easy gear to run, and it's very affordable gear. So we do ship worldwide. We do training. We do all of the pieces that help everyone feel confident in applying these principles. And I also go back to, it's really easy gear to run. And that's the whole goal of any product. This doesn't take a lot of training. We've had thousands of units worldwide for figure skating, and we really have kids at all levels and all levels of athleticism. I recently worked with a 2-time Olympian, and I was shocked that I improved his balance. So he did the balance mat, he spun with me, got back on, and this is a 2-time Olympian. And the fact that I improved his balance, I was like, Woohoo, look at that, you know, so these are things that we can really help the entire population improve.
Thank you so much, Sheila. Sheila, last questions. We are part of I have the Balance and Fall support group in aging adults. So we are a group of clinicians. Some of them are clients or caregivers. For a clinician standpoint, what will be your tips to improve balance? What will be the exercise that we can use on Monday? Something like that you can suggest and recommend.
I'm just going to keep spinning you. I'm just going to keep spinning you. And I'm also going to add in crossing that midline too. So to cross the midline and to turn in a circle, even with just the clients doing it on their own, stand up right now, everybody cross your hands and spin in a circle. And the interesting part too is certain directions are easier than others. So if you're right ear dominant, and how you figure that out is just like lean in. I have a secret. And I would lean in with my right ear. So I'm right ear dominant. So with that, turning to the left is very easy for me. But turning to the right is harder for me. So it'll be interesting to see if people have a favorite way to turn that's just easier than the other. But once again, in having to react to our gear is where we think we see even faster changes. I mean, I think both are good, but in the same sense, when you have to react to somebody manipulating it and you have to adjust to the speed, and as it gets faster and faster, and it's the challenge of staying balanced, it's a challenge. It's fun though. I do have to say, everyone is really good at that. It's fun.
Awesome. And for our family members, for our clients, clinicians, what will be your tip as an expert?
Enjoy. Like it really is fun, you know. And I think back of, like, do you remember the TV show The Biggest Loser, where they world-class trainers helped people lose a lot of weight, and it was a super inspirational show here in the United States, that, you know, these people really lost a lot of weight working with these really famous trainers. Same thing with us. We're going to improve your balance from the figure skating world, but we're taking on everybody: football, baseball, basketball, tennis. We're taking on aging population, kids with autism, the military, you know, traumatic brain injuries. All of those people still can benefit in the same way, that if I improve your balance and make your brain move a little faster, your life is better. And if improving balance, and I talk about the education of what that vestibular system is, just like we learn to count calories and we learn to count carbs and we learn to drive electric cars and a stick shift, like all the things we've learned how to do, we can still do. And if we can make that better, then everyone wins. So I can't thank you enough.
You are welcome. Thank you so much, Sheila. Once again, please try to put your website, how we can connect with you. I know we met in LinkedIn. Definitely, these clinicians would love to learn more from you. All right. So thank you so much as well. And we will definitely connect. And I would love to, again, introduce her because I missed that part on the recording. So again, guys, we just have Sheila Tillen, and she is a president of the Vestibular Training Services and a master rater figure skating coach. And she applies these world-class vestibular training tools, patent pending, but she got it already, in an innovation presentation on how spinning affects the vestibular system and how it can improve the brain's ability to balance and the cognitive process. So Sheila speaks about applying world-class athletic training tools to the general population. So thank you once again, Sheila. Definitely, we learned a lot. This is really good innovation from you. Congratulations. All right, guys, we're running on our last speaker. So we have Benga and his team. So he sent us a great video on how this they are right now in the training and some conferences. This is a great innovations, the new gate. So I'm sure, I hope you heard also the new gate, especially if you are a neuro rehab specialist. And Benga and his team is the one that introduced this. We interviewed him one point in Balance and Fall support group. So I told him to be part of the Innovation Summit. So Benga is the CEO of MQT Innovations, maker of the New Gate device. New Gate device is an innovative gait rehab device aimed at making high volume gait training more accessible. He is a professionally licensed engineer. He's originally from Texas, who's now in San Diego, California. Benga has a passion for health and wellness, which accidentally led to his introduction into rehab industry. Benga now leads a team of clinicians dedicated to helping restore hope to people with movement limitations. So here's Benga and his team. All right. Okay. Thank you. Tell me, guys, if you can hear it. All right. Okay. Thank you so much.
Hello, everybody. My name is Benga Adiko, and I am the founder of Newgate. Here with us, we have two of our clinicians, Kim Spranger and Kathy Ruprecht. Go ahead and introduce yourself.
Kathy Ruprecht, physical therapist.
And I'm Kim Spranger, physical therapist.
Perfect. And we will be telling Hello, everybody. My name is Studies, which will really highlight the various use cases of the device. And then we'll be wrapping up with frequently asked questions and then just giving you a little bit more information on the product.
So first, we're going to tell you a little bit about how this device came to be, in that we didn't get up one morning and say, hey, we're going to do a new device for physical therapy, but rather out of many things like we do in therapy, it was out of necessity. So this young lady was a spinal cord injury back in 2016. And you can see she has an incomplete spinal cord, which means that she had certainly some use of her legs, but that gait pattern that you can see was just not sustainable. We knew she would have problems with her ankles, knees, hips for years to come if she kept walking like this. So we started on this journey to figure out what it is that we could do to help her in this rural setting that in which I was working. And at the same time, Benga was out in California working with the track team and trying to devise something to resist the hamstrings while they were training their sprints. And so you're going to see it in a minute, that all the components that go into this device, but it was almost like turning on a light bulb. When we put the device on Emily the first time, it took her from the pattern that you're seeing on the screen to having much more stability and the ability to walk much more like what you're seeing in the other image. So we knew that we were on a journey, and then we started, Kathy and I were working together at that time. We started this journey of trying it with lots of other patient populations, and that's what we have the pleasure of telling you about today.
This is the new gait. It consists of several components: the waist belt, shoulder harness, and there are straps placed above and below the knee, which we call the limb straps. We've designed anchors onto which we can attach our elastic tubing. Therefore, then we can manipulate movement in a variety of different dimensions. And we also developed extenders to help make pieces such as the shoulder harness and waist belt fit a variety of client body types. The D anchors and the V anchors were designed a little bit later on after we began using the system, and they were designed to help allow us to place those elastic tubings in a variety of positions, but also to create greater comfort for the user of the system. And so in some of our upcoming images, you'll see the new gait without those anchors in place, but they are now a standard part of our new gait system.
The Newgate can be used really in a wide variety of different configurations to suit a wide variety of different types of patients and their body types.
You can see we have used the Newgate on a variety of patient populations. And so we've had it on people with muscular dystrophy, with Friedreich's ataxia, post-stroke, post-hip or knee replacement, and also with drop foot, just to name a few. We can place that elastic tubing to assist with a variety of things such as hip flexion, hip abduction. We can use it to provide stability and hip extension. We can use it to place elastic tubing to assist with toe lift and also with plantar flexion movement patterns. The question we often find is, well, who should use the new gait? Or therapists may say, I'm not sure who to use the new gait on. And the bottom line is, if you've got people walking, you've got people who probably need the new gait. So we have had it on orthopedic patients. My specialty was working with folks with chronic and persistent pain, for which we found the new gait to be significantly helpful. And as you look at the device, and if you are a therapist, you might think, well, certainly that would be beneficial to those with neurological conditions. And we also have found benefit there.
Now I'd like to go over how we believe the new gait is working. Number one, we believe that it is increasing stability in the stance phase of gait and enhancing mobility in the swing phase. 2, the elastic nature of the bands stimulate muscular excitability, provides joint approximation, enhances body awareness, balance, and positioning.
I can feel my body, if that makes sense.
Oh yeah.
Without it, I just feel like, remember those toys when we were younger? It was like a base, and you push up and the body.
Yeah.
That's how I feel when I walk without it. When I walk with it, it's almost like it just pulls everything in again. I can feel my feet coming up and down.
And 3, the new gait allows your patient to experience a stabilized, normalized, and functional walking pattern, effectively rebooting the somatic nervous system.
In the closet, wait for the next time. When you take it off, you can actually feel what's changing in your brain. Like you can feel your body go, oh no, that's not how you're supposed to walk, Caitlin. Like it actually is still telling you this is how you walk right, and it kind of makes you do it. It's just that after that little bit of time, if you're not wearing it every day for 20 minutes, it does do the fading away. But it's crazy how it, like I said, it's literally your brain telling your body, and you can feel that over, you work in PT and then you're super sore. You don't really feel like you're getting better. You can feel you're getting better right when you take this off. Yeah, the pain comes back, but you can feel your brain saying, go the right way. Which is pretty neat.
So as Kathy said just a moment ago, anyone who is walking, as therapists, or even when you're walking through the grocery store, you will notice people have different walking patterns. And we like to think about 3 words when we think about how people walk. We look at the energy in which they're walking with, the symmetry in which their body is moving, and how they flow from one step to another. And what we're really doing with the new gait is we're changing those 3 things. Interesting enough, it's those 3 things that people will complain about when they say, it's so much effort for me to walk, or I don't feel balanced when I walk. And so really by hooking up these bands in specific ways based on what they're missing, you can change those 3 parts of their gait pattern. So now we're going to tell you a little bit about and show you a couple of examples of what I was just talking about changing energy, symmetry, and flow in how people are moving.
I'd like to introduce you to Barb Stenberg. Barb had developed quite a significant drop foot, and as you can see, quite a significant Trendelenburg gait pattern, and a lot of instability, and a lot of fear in going walking without someone to hang on to, particularly her husband. So when Barb first came in for therapy, she discovered the new gait through a mutual friend who had been using the new gait. As a matter of fact, our first new gait user, Emily, and Barb came to see Kim in therapy, and they tried the foot drop bundle on Miss Barb, which helped significantly to clear her toe for ambulation. But she still had some abnormality with gait instability. So we invited Barb to come back, and we then put the whole new gait system onto Barb. So what you see with her on the right-hand side is the first use of what we're going to call the 3D hip and bilateral dorsiflexion. And I'm simply holding on lightly because Barb is coming down a ramp for the very first time in the full new gait system. But you can see where the elastic tubing is placed to provide that pelvic stability. And you can see that her step width is better. She is toeing out less. You can see her pelvis have better stability, and she also has some improved postural alignment as well. And she mentioned that the back pain she's had for a very long time to be gone.
Now I'd like to introduce you to Diane. Diane came to see me with a post-tib fib fracture, so it was healed, but she had not only had ankle pain and stiffness, but she had hip pain and back pain. And you can see the pre-Newgate gait pattern that she was displaying when she came into the clinic. So by her third appointment, we had done some good work as far as trying to improve the range of motion at her ankle, but she still had some gait pattern that was just kind of like, despite having improved range of motion, she was kind of stuck in this gait pattern that she had adopted over this time when she was immobilized. So we put the new gait on her, and again, it was like turning on a light bulb. She just immediately, she could feel the motion that how she used to walk, and you can't hear her words with her mask on, but she just kept saying over and over again, wow, this is amazing. Like, I can walk like I used to walk again. And actually, we only ended up seeing her for 5 appointments altogether, and she was completely restored in her gait pattern. And you can see that the difference in the energy, the symmetry, and the flow from the very first pre-Newgate picture to the final picture where, and we're going to talk in a minute or two about carryover, that even after she was removed the device, her body very quickly remembered how to walk correctly. And then she didn't need to purchase the device, she just used it in the clinic setting. And then I want to also introduce you to this fellow. His name is Rodney Rogers. Rodney is an 80-year-old who was hit on his bicycle that he rides 30 miles every day. And he was left with a calf rupture and a pelvic fracture. We actually did not start working with him until he had finished his recovery down in Florida and was back up in our area for the summer, and coming back in with a shoulder and neck problem that was coming because he felt so out of balance actually when he was walking that he was guarding a lot, and that was causing all this upper body issues. So when I initially walked with him, you know, I could see this instability, and we discussed that. And then he tried the unit on just one time in our clinic here in Michigan before he left to go back to Florida for the winter. His No Fault Auto then decided that they would purchase this for him, and we really did all his training with this device virtually. So he was able to obtain it, understand through just our virtual conversations how to donate on his own, and then he started to go for a 2-mile walk every day with the device on. And just the feedback that that device gave him, he measured not only the distance, but the speed in which he was walking and his heart rate, so we can really see how much exertion he was making to walk that distance every day. And to see the change in that over time was really remarkable. He no longer uses the new gait at all. He's back biking. He's done a century bike ride, and he is walking independently over his community and in his home.
And just to add that in just 3 months of using the new gait and walking his 2-mile walk, he improved his time by over 42% from when he started. And that was simply by walking. He wasn't assigned a special exercise program. All he did was walk on a daily basis. And now we're going to get into some common questions that you may be asking in regards to the use of the new gait. So you've heard several different stories on how it's been able to help people. Now we'll get into some common questions that we get asked by clinicians and even patients alike.
So once you have the new gait on, lots of people have the question like, well, okay, so it's on now, what do I do with it? And in the clinic, anything that you're doing that is functional and closed chain is where I'm using the new gait. So if I'm working on single leg balance, or I'm working on any kind of balance activity, or standing strengthening, especially if I'm trying to strengthen the extensors, I'm going to have the new gait on when I'm doing this. And as I was alluding to with when I was working with showing you the video of Mike, you can be really creative as far as if you're going to use that tubing for an assistance, a stabilizers, or a resistance. And you can, it's so easy to change them because it's just 2 carabiners that you can, even in a particular session, when you switch exercises, you can change where that band is and what color you're using, or take one band off so that you can resist a different muscle. So it's as creative as you want to be. The new gait can accommodate for that. As you can see, we also have used it with the gait light. So when you're dealing with somebody who's just getting up to walk for the first time, you can be using it to, instead of trying to lift that foot for them, where many clinicians are, we're using the new gait and the elastic tubing to actually be the lifter. And so again, I'm just encouraging you to be as creative as you can be as far as how to incorporate the device into your open chain and balanced standing kind of activities. People also ask us the question, is more resistance better? So these bands are different colors based on just like regular TheraBand or TheraTubing. So the yellow is the lightest and the blue is the thickest durometer or stiffest. And it depends, again, what you're trying to do. So sometimes we start with more resistance because they need more stability, and then we move down toward yellow so that where they need less. And then if you are working on trying to strengthen, you might start at yellow. So now you're using it for resistance. You might start at yellow and work up blue. So I wouldn't say more resistance is better. It's more like it gives you more options by having different colors of bands. And then the question out there is always carryover. People see this on like what you see on Rodney Rogers here, and you're thinking, wow, do I have to wear this forever? Or, is this something that eventually I won't need? And it really does depend on the condition. When Julie has Frederick's ataxia, we know that that's kind of a progressing condition. And so it's just helped her become much more functional in her community for where she's at right now. And also with Dave as a TBI patient, he may be using that long term, but they still have carryover when they use it maybe 2 to 3 hours a day. And then there's carryover in the home when they don't have it on. Other people like Rodney Rogers needed it for 3 to 4 months. And then after he had retrained, there was so much carryover, he didn't need the device at all anymore. So the answer to this question is yes, there is carryover. How much depends on the condition that they're using it for and their consistency of using it at home.
And now a lot of people will ask a few of the questions that I have here. So one, cleaning, how do you clean it? How do you disinfect it? And so when it comes to the NewGate, the material is very similar or actually the same to that of a wetsuit. So it's got neoprene and there are some other webbing type materials to it. And so it can be disinfected with just a hydrogen peroxide spray. So if you're using it clinically, you can spray it down with a hydrogen peroxide spray in between uses, allow it to air dry. If it is greatly soiled, you can then just hand wash it with using mild detergent and then rinse it off with water and let it air dry. And it's actually very rare that it would get that soiled, but typically what you're doing is disinfecting it in between uses.
A common question should be and is there any contraindications to using the device? We have listed here the things that make us stop and say, is this device for that particular person? And some of them are obvious, like an unhealed fracture or unstable cardiac condition, but some are less obvious, like osteoporosis or kyphosis. You don't really want to, that's a caution. Sometimes we try to correct kyphosis with use of the shoulder harness and the waist belt, but we try not to put nearly as much tension or compression through the system because of the danger of getting some kind of compression fracture. Significant limb edema or a DVT, because this is neoprene and we're wrapping it around a limb, if they have edema, they can of course make that edema worse. Or if there's a DVT in there, that can certainly be a concern or a contraindication. Unhealed incisions like post-op total knee or total hip, we'll wait until that's well healed before we try putting any limb strap across that area. You also want to check for any kind of implanted devices or a colostomy bag before trying to put a waist belt on. And there is latex in the material, so if they have a latex allergy, that would be a contraindication. So those are just some things to definitely consider. We also have found that if we are using it on someone who has a leg weakness proximally, that should use just the distal component is not indicated because sometimes it can cause the whole leg to buckle on them. So we really would recommend that condition that you would use the whole device and not just a dorsiflexion assist.
All right. So those are our speaker for tonight, guys. Okay. So if you have any questions for let me put it here. Okay. If you have any questions for the NewGate, they have this trial program, and you can email me if you're interested to learn more about it. And then we can send your emails. That way you're interested to learn more on those trial programs. Because I remember Benga said that they can offer a trial program for those some of you guys that are interested, so you can have a feel of it, especially if you know somebody or you have a you have a clinic that you want to try for your patients that you might have, especially you're in neuro, ortho, and then wherever you think that will be applicable in your practice. Okay, so I think there you have a 30 days trial, or I'm not sure, but definitely we will connect you with Benga. Okay, and these are the new gate pros. So I just want to have and also still put your questions and I can email it with them because they're right now in the private practice conference. And also I would like to share for tomorrow, we will begin 8:30 in the morning Eastern time, and it will be 8:30 tonight in your time, guys. Okay, so just want to give you a heads up of your day 2. This will be your speakers, and for the day 2 will be can you see me? Can you see, guys? All right. So here are your speakers for day 2. So we have Max Pro, that's Nizar. Max Pro, it's a portable all-in-one gym that you can bring anywhere. That's really cool. And Walk Kneeler is a physical therapist. He's a Filipino who invented a walker where if you have patients that cannot, or non-weight bearing, or some injury on the other leg, that the doctors are not allowed, ordered not to put weight on the other. So this really a good alternative for crutches or scooter. And Motion Therapeutics, that's a balance-based torso weight. If you have seen those balance weight vests, especially if they have those issues with balance, tremors, perturbations, these vests are with weights, and Tammy will going to teach us and talk to us about how does it work, okay? And Meditouch will be a perturbation treadmill, and Melvin will be talking about an augmented reality, especially so it's a augmented reality. You have virtual reality a while ago. So this is a virtual reality that's you're really on it and you're seeing those things, all right? And these are really good for Parkinson's disease. They're only for Parkinson's. We have the neuro rehab that is in different neuro cases. This one, Stroll, will be for Parkinson's. So those are some of the topics that we will have for day 2. So I'll see you 8:30 in the morning for Eastern time. And if you are in Philippines or in different locations, check your time, okay? So that will be 8:30 in the evening tonight for you guys. All right? Thank you so much, guys. Email me if you have any questions. I believe you know my email. It's jenny21ptrp@gmail.com. And we can forward your questions to specific speakers. That will be just put there for specific speakers or topic, okay? So thank you so much for this is day 1. And if you find helpful at some point, feel free to just, if you can donate something for future foundation. I think that will be showed in the previous one. So any amount will do, $1, $2, you know, that will be helpful. But if you donated like $10 or more, that will be very helpful, and we thank you. I'll give you a certificate of attendance for this course as well. All right, so we appreciate your presence. I'll see you again tonight in Philippines and tomorrow morning for us here in US. All right, Cheryl here. Can patient buy them without prescription? Will insurance covers them for regular use? I think this is out of pocket. And yes, they can buy this without prescription because we are the physical therapists who are recommending to them. But definitely I can confirm that with them because you can just use this. Even you are like me, I'm recommending this to my colleagues that if you have, did you try these things like that? We are the one, that's the reason why I would love us to be aware of what are the technologies nowadays available out there that are applicable for rehab, neuro cases, stroke, Parkinson's disease, and ortho, you know? So they are there, and we have those web-based that you can add in your clinic. So these are the options, all right? So thank you, and I'll connect with you tomorrow. Bye for now, guys. Take care. You're welcome, Joy. Yes, yes. Thanks, Melanie. See you soon. All right. Check your, so this will be 8:30 for your time as well. All right. Bye for now. Thank you. You are welcome, Mirna. So tomorrow, right, where are you from or what settings? That way we can see how applicable it will be. Like, I'm acute. Yes, yes. Thanks, Susie. Susie, you're here. I saw Erica a while ago. Bye, guys.